Steve, you there?
Yes, sir.
We just did the Pledge of Allegiance, so.
Okay, I apologize. I should have waited a couple more minutes. I'm sorry.
No, you're fine. We just did that, and since I got you, we'll go right to you for an up.
Okay. Well, good morning, everybody.
Morning,
Steve.
Yeah, we'll hear you good.
Okay, good. Hope everybody's doing well. I have nothing to report to you on the property tax front. There's still a lot of discussions going on that. So I've got nothing to tell you on that. I can tell you that I have submitted one bill that will probably be of interest to you that was brought to me by some Shelby County supervisors, and it relates to the EMS levy that we passed not being TIF protected, and the feeling that, you know, when taxpayers are voting for the EMS levy, they're not voting for it to be TIF. They want that money to go to support EMS. And so I do have a bill that would make that a protected levy. I'll be glad to have input on that. There'll be a lot of discussion around the bill. It may or may not move forward, but in any event, that was something that was brought up to me by supervisors, and the feeling that, you know, taxpayers weren't really getting the true scoop when they voted for it, thinking their money's going to the EMS support, and then it ends up being TIF. So other than that, as far as things that I think you guys might be interested in, I can't think of anything else, and I'll be glad to take any questions you might have.
I think that's great that you protect that EMS levy, because even if we end up having to do that down the road with Crawford County, you know that that money is going directly towards those services. I thank you.
One other question I would have for you that's been brought up to me, some of the TIFs that were prior to the bill that was passed that put, you know, requirements on them and timelines and all that, the ones that were prior to that legislation, according to supervisors in Shelby County, is costing them billions and billions of dollars a year, and they just keep getting extended and extended, and it's shifting that tax burden to other taxpayers. That's something that I had mentioned to Bobby Compton, the chair of Ways and Means, that we need to look into, see what we can do about as we're having this property tax discussion. So I would also appreciate any input you might have on that issue as well.
Go ahead, Ty.
I mean, I'm not real sure what all that's in reference to. I guess I've never talked to anybody down there about that, Steve.
Yeah, we need some more details to know the full story on that one.
Okay, so I'll tell you what I know, and I can't tell you the exact year, but I can look that up and share it with you. So years ago, in the early 2000s, the legislature passed TIF reform, in which from that point on going forward, they had dates, you know, they were just much stricter. They had completion dates and all those sort of things. The TIF prior to that were sort of on the honor system, and apparently, from what I'm understanding, is cities that they're just extending them and extending them and extending them. And according to the graph that was shown to me by Shelby County Supervisor, it's costing millions and millions of dollars that is being shifted over to other taxpayers because these TIFs continue sort of into perpetuity. So that's something that's been brought up that maybe bring them in line with the legislation that was done. I'm sure for political reasons, they just did this not retroactive and going forward because people were pitching the fit, but now we've got those TIFs hanging out there that just are continuing and sort of shifting that tax burden to other people. So that's what I know about it, and we're looking into that, seeing if there might be something that we can do about that in the context of the property tax reform discussion.
Okay, keep us informed on that one.
Yeah, Steve, I guess I didn't know that was an issue either. I always thought that the TIF was always designed, you know, went towards something specific or for a specific time frame. I didn't know that they could go on for perpetuity.
That's how it is with all of them from the point they passed that law on. But the ones prior to that, apparently somehow, because those particular provisions are not in law, they're extending them, and so they get extended. I mean, it was into the graph I saw suggested it was into the millions and millions and millions of dollars in Shelby County. And so that's something we're going to look at. That's the extent of our knowledge on it right now, but we're looking into that. So,
Sounds like the city's grabbing that TIF money away from the counties. What I'm hearing.
Huh, well, not just the counties, other levying authorities are affected by that.
Right, all.
Schools.
But, there has to be debt, usually there's debt to support a TIF, so I don't know what's going on in their county that's making that happen.
That's exactly right.
Right. And I'll get more details, but because when I brought it up to the to the Ways and Means Chair. He was very familiar with it, and he also agreed we had to do something about those TIFs that were in place prior to that law being passed. So it may not be an issue in Crawford County
Right.
in the same way. I don't know. But anyway, that's something that we'll definitely be looking at as we have this property tax reform discussion, because again, if there's sort of abuse going on, I'm not saying, I don't know if abuse is the right word, but if
Right.
there's something we want to change in that, because again, that's taking that you're just having to shift those the burden on the taxes to other people when that's going on. And so that's on our radar. We'll see what happens on that.
All right. Steve did those reports. I sent you that kind of help for breakdown of, for like recorders, revenue
Yes.
and treasurers. And then,
Absolutely. Thank you.
just so you know, Craig also forwarded those on to his contact.
Right. Right.
Okay.
Steve, on that note, I just wanna reemphasize something. You know, in the courthouse, we're working quite diligently to find other sources of revenue other than property tax. Obviously, that's a big issue down at your building.
All right.
So we're trying to find other revenues, and this is gonna be a key revenue, them people being able to charge a fair price, but a good price that offsets property tax monies. I mean, we can actually generate a fair amount of money if we're not sending the lion's share of the pie down to the State House all the time on these fees, where we're doing majority of the labor. I mean, I don't wanna beat that horse to death.
That was a shocking breakdown to me. I didn't realize so much of it was coming to the
When you
state.
sent
So,
me-
Yeah, so and that's what we're trying to do. That will help, you know, like Jason said at the meeting that one day, you know, you guys gotta find ways to make this work. Well, this is a key way in helping us make
I
that
didn't send
work.
him that.
right,
Okay,
right. I will definitely share that info with Bobby, as he's working with Dan Dawson to put together whatever the property tax reform is gonna look like. So,
thank you.
we'll see. Thank you.
That will help.
Craig's popping up. He's had another real interesting one for a year's worth of treasures, collections. I did not send you this numbers, but
And
here,
this is just what I compiled with some information I got from our county treasurer, but for from July 1st, 2023 to June 30th, 2024, that fiscal year, the treasurer collected $7,037,277 in fees. And of that total, $6,803,424 was sent to the state, and $233,000 was kept by Crawford County.
Yeah.
It doesn't even
so,
cover wages.
yeah, there's just some discrepancies there.
That doesn't even cover wages.
I guess, Steve, a question for you while we got you, on that note. What does the state do with those funds once they receive them? Is there admin, fees or, I mean, if we collect, any of those fees from the treasury recorder, do you know where they go?
No, I'll have to find that out. I'm gonna conjecture that they probably just go to the general fund, but I'll have to find that out. I'll ask those questions and we'll try to let you know the next time we have a meeting or email it to you.
Okay.
So I don't know at this point.
'Cause, I mean, to me, and we don't mind doing those services, and I think we got great staff that do them, but in a way, we're subsidizing those services with property tax.
Yeah. Well, and one of the frustrations we have on the state level, guys are probably aware, I hate to use the term backfill, but we sort of backfill the TIF money that would have gone to education, the state backfills that. So there's just so many complex formulas and all of this budget stuff, whether it be education or whatever. It's just incredible how complex it is and how many tentacles there are. And so one of the things, we have to build in automatically to the budget that we have not a lot of control over is backfilling the TIF that would have gone to education. And then from upstairs, the federal level, we have to do, in a lot of cases, we have to budget for mandates from the federal government. I know you love unfunded mandates as well, but a classic example of that is the federal government hugely expanded Medicaid a few years ago. I mean, huge. And then they have slowly phased out to where now we're going to be picking up close to $1 billion of that in the coming years. And we budgeted for all that, but those are, some of the same things we face that you face in terms of we sort of don't have any control over some of that stuff. So.
Okay. Perfect. Anybody else have anything?
No, thanks, Steve. We really appreciate you coming in
Yeah,
and
if you-
joining our meeting.
If you, I don't know if you got invited over to our statewide supervisor meeting on Thursday, but you're sure welcome.
I do, I have that in my schedule. My only problem will be what my meeting schedule looks like. There's no way I'm probably gonna know until Thursday morning, whether I'm gonna do that or not, because if caucuses are called, things of that kind, but it is in my schedule. I plan to attend, if I do not have scheduling conflicts that forces me to be in the building.
I understand, just,
I'll get on the bus and head down there if I can, and as soon as I know more on what the property tax stuff is gonna look like, of course, I will, let you guys know, so.
sounds good.
Sounds real good.
Thank you all so much.
Thanks, Steve.
Hey,
Thanks, Steve.
thanks for the update.
Have a great day.
You too. Bye.
Yeah, bye-bye.
Good update. Let's review agenda, any conflicts?
I never realized there was problems like this. I'm sorry, go ahead. No, I have no objection.
Okay, agenda approved as written. Reading of the minutes.
January, excuse me, January 21st, 2025, the Board of Supervisors met at 9 AM with Dave Mulbauer, Chair, presiding, members present were Schultz, Dozark, Mulbauer, Hayden, and Rosberg. Minutes of the previous meeting were read and approved. The board approved clerk of court fees for December 2024 and the weed commissioner's report for 2024. The board approved the resignation of Leslie Getz, RN, Home Health and Hospice, Public Health Department. The board approved the change of status for Amy Truckee, full-time Family Steps Program Supervisor, and Cheryl Lair, full-time RN, Home Health, Hospice, and Public Health Department. The board met with Paul Plum, CDC Director of the Chamber and Development Council of Crawford County for a quarterly tourism update. The board met with Seth Weiss, Assessor and Zoning Administrator, to discuss zoning administration, and the board is still reconsidering other options. The board had a discussion about Resolution 2025-11, Elected Officials Compensation Board recommendation. The average consensus is supervisors, $1,000 increase and $1,250 stipend. Attorney, $2,800 wage increase. Auditor, recorder, and treasurer, $3,000 wage increase. And the sheriff, $6,000 wage increase. No action was taken at this time. A motion was made by Dozark, seconded by Hayden, to approve the following wage publication for 2024. Motion passed unanimously. A motion was made by Schultz, seconded by Dozark, to approve the treasurer's semi-annual report, July 1, 2024 through December 31, 2024. Motion passed unanimously. On motion duly seconded, the board adjourned at 11:41 AM. Agendas for the next meeting are posted and available at the courthouse on Friday, 4:30 PM, preceding the next meeting.
Terry, can I ask what we agreed on the attorney? I didn't.
2,800.
2,800.
Yeah, 2,800.
All right, thank you.
Yeah.
Any other questions or comments? I remember it.
No objections.
Going to supervising reports. Craig.
I didn't have anything this week.
Seems so
Got a
long.
early childhood meeting today at noon. And, that's it.
To Wesco.
I did tour with the new Wesco building yesterday. Correct. Thank you, Dave. So they're gonna, that's gonna be very nice. They're gonna put a lot of money into that, facility to get that to where they want it to be, but, they have the backing to do that, so. It's gonna more than double the size of the seating area for the bake shop, which would be nice. I think they can get close to 60 people in there.
That will have a drive-through.
They are gonna have a drive-through, which will be clear on the south end of the building on the west side. So, people can drive up and then just either turn right and go back out on the street and leave, or they can take a left at the alley, drive down the alley and leave. So, and then you're gonna have conference center in there that they think will seat up to hundred and twenty-five people that they're gonna rent out. In addition to having the bake shop in there. And they're gonna, Wesco's gonna use that for their training facility, also for their employees. So. It's gonna be nice when it's done. It's, you know, it's right there on their campus, basically. It's right there. And they got the sign as part of the building of the purchase also.
All right.
So they're ordering a new sign to put up there, so it'll be nice for Wesco to have a little Highway 30. I think they estimated that there's 10,000 cars that go down Highway 30 every day, and so that'll certainly give some advertising, if you will, for the bake shop and to promote Wesco. Wesco wants to be more part of the community, and this will allow them an opportunity to do that.
Will they completely close the bake shop uptown? or
Yes.
just- Yes.
And that'll be roughly, I mean, I told Clay yesterday, I said, are they gonna have this, we're gonna have it done by May? And he said, contractor thinks he can do it in 2 months.
Really?
So we'll see.
We'll see.
Okay,
Good job. Yeah, I think that
So 4,
What's that?
so 4.
4 months.
So, well, Juan's doing it and
Oh,
Juan's got
that
what?
might be 2 then.
He's got 2 crews and there were 2 guys down there working when we were down there doing the tour and,
He does a hell of a job.
He does.
Right.
He keeps, they'll work all night
yeah.
to get it done. I've witnessed that with
And
my,
he said, I mean, Clay said that Juan told him that if you find me more work, I just find more crew. So,
love it.
that's great to hear.
Any update on their housing situation?
They've got the one that they're building all enclosed and, that one should be done. It's gonna be a 5-person home and that's gonna be done, I think by May, that was gonna be done. And, it's already, they have 5 people on the waiting list to go in there, so it's gonna be full the second it's done. And, that's the kind of the floor plan that Wesco designed, so moving forward, if they would choose to build more, that's what they're gonna look like. They're not gonna have a basement, they're not gonna have a garage, it's just gonna be a flat concrete. And then kind of the bedrooms around the outside, you know, living room, gathering area in the middle. Yeah, they'll all be handicap accessible.
And that makes sense.
Yeah.
I mean, it really does, good design.
Yeah.
But you, no worries about at one time they wanna do?
They're not, Wesco, formulated a letter concerning the 5 beds versus the 4 beds that they sent to, Health and Human Services. I took that letter and forwarded on to my contact at the governor's office and said, hey, make sure whoever sees this needs to see this. And so, Wesco's still concerned about that, but when I last had the discussion, with the governor's office, that it was like, the governor needs to sign off on something from the Department of Justice in order for that to happen, and it's like, she ain't gonna do that. So just, it would boil down to if the feds would play hardball and start maybe withholding Medicaid funds or withholding something from the federal government to make them do it. But, with the new administration, new leadership, I guess we'll see where that goes, or if that changes anything, because as we all know, a lot of times it's the bureaucrats, not so much the elected officials that are in charge of that, and bureaucrats don't change.
Like, that'd be extremely disruptive for.
It would be, yes, yeah, for Wesco's profitability, it would hurt them immensely.
Okay, anything else?
That's it.
Thank you. Jean?
First off, is this for wages as of what date?
Should be W-2 wages.
W-2 wages for last year?
Yeah.
Okay. All right, some of them seem different than what I thought, but,
You'll have to ask Amy about it then, I guess. Yeah.
quick question. Last week, I think that was kind of a blur.
So that would like include, sorry.
Go ahead, nope.
On Rogers, it showed 105 instead of 97, so that'd probably have some overtime and stuff in that. That's why it'd be W-2 wages.
I'm just,
I can ask, I'll ask that.
Yeah,
I don't
that
wanna
was,
tell you something that's not true, cause
It's
I
kinda-
don't know
that was the
exactly.
question I was asking her, if that's what that
Oh,
was.
okay, is that the one in question, you think? that
Well,
you
I mean,
saw?
Stuck out
that's
a
the only one
little
that
bit.
stuck out to me.
because
Okay.
those numbers are so fresh from what we were looking at.
Want me to go,
where we're at.
let me go find out.
Okay, thanks.
So we gotta approve that
Yeah,
anyway.
'cause we gotta approve it, so.
It's not really a committee, but there's been phone calls of concern of immigration here in Crawford County. Phone calls concerning, what it's gonna look like. People are really concerned that ICE is coming and going to raid the schools. Kids are gonna come home, their parents are gonna be gone. What the workforce will look like. I had a phone call, aren't I terrified what our workforce is gonna look like in Crawford County? And I think that they're trying to get a forum going to just kind of distill those fears. Because I truly don't believe that that's what's going on. There was, I guess, ICE was out at Walmart, but it was on a specific person. And so I think they want to get that word out to people, it's not to fear that they're not gonna come into the schools. I think Steve Holt had a thing on KDSN a couple days ago. But just kind of wanted to get that out there, that that's something that's a fear. I just think we should calm that fear if we can. We just don't see that happening. Tomorrow I have Buena Vista Crawford Sac Early Childhood, and then we have DCAT in the morning, and then we'll be leaving our meetings in the morning. But otherwise, not a whole lot, I don't think, just a lot of just miscellaneous phone calls about miscellaneous stuff. This is kind of our busy week.
Yep.
It's just our busy week.
I have an answer for you, Roger. His included his payout of vacation and comp time from when he went to a non-elected individual to an elected
Oh.
individual.
See, curious
I
minds.
figured there was a simple answer.
Yeah,
Yep, they're.
And she usually has them asked before we get to the meetings.
Well,
That's why I asked
they don't let me
her.
highlight on things until they're actually my documents, but I was gonna get a copy of that kind of.
Okay.
Over, but yeah, I don't think I've had anything last week. Blur, but anyways, if I think of something. I'll
Okay, perfect.
do it Later.
Ty,
I have not heard back from Washington yet. They just sent another message, it's everyone volunteer issue.
yeah,
And, let's see. I had a few meetings last week.
but you did sound like they were aware of the issue.
Well, I'm not gonna say that. I mean, I didn't get word back from up there yet. That's why it's kind of perplexing. Usually I get a word back pretty quick, but a couple of my staffers that I usually talk directly to that worked up there have actually moved on to different job. One came back here to National Pork. She's not helping me there anymore. But, I expect to have something back soon. I just sent another message to Colby. Usually that gets him fired up. That's he's a good egg. Anyway, yes, I had meetings last week. Let's see, first and foremost. We had the EMA Executive Committee we formed for helping him with budgets and other things like that. That was a couple of the things that we'd actually already went over that he hadn't tightened back up on the budget. But, good meetings. I mean, he's just cooking. He's doing a damn good job for us.
I'd like to piggyback on that it was excellent yesterday for such a short period of time, what he has accomplished and what his goals are, and how organized and professional.
Yep, he's doing an outstanding job. That was good hire. We're getting good at hiring, sadly.
Yeah.
Okay. Then I had an economic development meeting. I was gonna go over to Central Iowa Juvenile Detention because of closed session stuff. But ended up with an economic development meeting. And that was actually, we were also discussing the concern in our Hispanic community in particular, but all of our immigrants are a little worried about it.
Yes.
I think if you're here legally, you don't have anything to worry about. The ones that, oops, speaking of Washington.
All right, perfect
I'll call
timing,
him back.
perfect
Hold
timing.
on. Calling back right after this. Where was I? Oh, I think the biggest concern you're finding out there is were kids that were born here and parents that may not have everything in place or have documents that are being approved at this point, or, you know, there's just fear and uncertainty because they think they're after everybody. And, you know, I think that that's a legitimate concern because there's not been a lot of information forthcoming other than we're coming to get the bad ones. That's all we do know for sure. And when I was told that there was some in the parking lot over here at Walmart, I did a little snooping, and it was supposedly only one person they were after,
That's right.
but it was a bad person. So
Right.
so that's what we wanted to come get, right?
But
But-
that had been in the works for a while. That
Yeah.
didn't just, happen, and but that just spread like wildfire.
Well, the uncertainty is there. I mean, that's just it. And it's one of them things where you can't tell everybody we're coming,
No.
that bad person will be long gone otherwise.
Nope.
So I mean, you know, we've got a great community here and we're blended very well. I hope that everybody here is here legal and we could keep, and everybody's here, but you know, there's obvious legit concern. I remember when I was still sitting on that side of the banister. Dave, you remember the couple that they were having trouble with do you remember that? Those are the ones that I'm worried about right now.
Yep.
That are working on something and it's, you know, kind of touch and go at this point. Their lawyers are working hard to get these things done, but them are the ones that if I'm worried about somebody, it's them.
Right.
You know, because they're really
Great
they're trying to
assets.
do it right.
Right.
And I don't want them to get screwed in the process, you know.
If I can piggyback off that just a little bit, it's really hard for the individuals that came when they were children and were accepted into the schools, everything's going. Parents didn't really have the money because it is expensive, or it used to be, to find an attorney and have that attorney work through the paperwork, takes a long time. And they're here, haven't done anything wrong, are good law-abiding citizens. And to have that fear, you know, if you broke the law when you came across the border, that's undeniable.
Yeah.
But there should be a little bit of a fast track to help the folks who are working every day, haven't broken any laws, not on the system. You know, those should be some qualifying questions that, you know, because the folks that come and believe everything is free here and have used the system is another thing that I think is kind of hard, because there was a rumor that everything is free. And
Well, I've been asked by a few people what my opinion is on all this, and I don't know what all took place here, because you know, we've got people that they flew in from other countries and dropped off. I mean, there's all kinds of rumors and things that are, I don't know.
Yep.
But if you were somewhere and, you know, whether it's a representative of the State Department or some outlying organization that was down recruiting people, and they're just legit people that were hard up in their country, and you're offering them a chance at, you know, we'll help you get a start in America, and they were basically invited here. Otherwise, they probably wouldn't have left their country because
Well,
they
not
didn't
worried.
think they'd make it here either, because they didn't have a penny to.
Yep.
You know, get one way or the other. So them are the other ones that I worry about, you know, that's personally, you know, that's me, you know, that's not, I mean, law is law. But if you were invited, or you believe you were invited,
Yeah.
and you get here and then.
And you paid money to get here.
Yeah, and there's some
A
of
lot
them
of
that paid a
times
lot
you
of
pay
money,
money.
so, I mean, buyer beware in some sense, you know, that's kind of an old American adage you hear all the time, buyer beware. But if you thought you were invited legally, and then so, to me, sometimes we might have to take some of these, as they start getting rid of the bad people, we might have to start doing more on a case by case.
Everybody has
basis.
their story.
Yeah, well, there you go.
And I just think that, I wish there was.
So, I mean, I do wanna clean up America, but, I don't know, I'm books that I told you about. You know, how America needs population, and that's the only way you're gonna sustain your economies in the years to come. You know, I mean, if people wanna be here, I mean, you know, if their kids are in our schools and don't even have an accent, them aren't people that are leaving. They're here to stay, you know, and so they're making this a home, and if it's your home, most people wanna make it a good thing. So I think we gotta make sure we keep wrapping our mind around all that, and I'm not saying that if you've done illegal things, if you're here doing anything illegal, and people that are stealing hotel or apartment buildings,
Yeah.
they should have been gone. And I think they probably were the first day, but the rest of it, you know, I think you gotta start looking more into where we might be complicit, how's that, you know?
But I mean, we need a smart immigration policy, and
Yes.
unfortunately, the federal government is in charge of the immigration policy. And we usually don't get things very smart from the federal government.
They don't
And
live in
so-
this real world of ours.
No,
You know, I heard it on Fox. I was just listening to it this morning there. And, there was actually a really good comment made about law enforcement and how they're all working together real well. And how ICE and the FBI and them are really leaning on the local law enforcement. I think I don't remember the exact wording, so please don't take this as a quote. But because they know their people, they know their city. And so they're gonna be better engaged at knowing where these people are, being able to move in somewhere safely. Not get anybody hurt in any crossfire or something, but they're also gonna know the people that need to be gone and the ones that we should probably check this out. I think that was the point that Fox was trying to make, and so that's kind of the message that I'm getting. Hopefully that, when, you know, Noam was actually out there on the street with them there. You know, they had video of her out there this morning out there, so hopefully she's bringing some of that Midwest, I got heart to the arena.
and common sense.
Common sense, yeah, there you go, yeah, she's a good old ranch girl, she might have a little bit of that.
That's why local government, we all know it is so important because we
Exactly.
are on the front lines of.
Yeah,
Exactly.
I wish they'd ask us.
Yeah.
So, and I mean, I've been trying to stay in my lane, but, you know, I mean, you know, these are our people that we're here fighting for every week, so, you know, you still wanna, you know, look after and make sure that Crawford County isn't just a disaster zone after everything's cleaned up, you know what I'm saying?
We have no home rule on that one.
So, I mean, we'll just do the best we can while we're, I mean, we don't have a lot of influence,
just
but we'll do
don't-
the best we
I
can.
just don't like
Try to
people-
keep them informed on what we're seeing and, you know, no different than the volunteer thing.
I don't like people living in fear. You know,
Mm-hmm.
that's, something that you have to empathize with, that anxiousness that could possibly be, you know, and you just wish you could calm that, but we really don't have the exact answer. We just know what the law is and what we hear, so.
Okay, so, that's something that we discussed, and we discussed a few other things about stuff that we're working on in development. I'm not planning right now on going to the International Economic Development thing again this year, because we just don't have, I mean, we've got a couple things, but nothing shovel ready. And it really kind of bothers me because this year, probably, especially since I actually got an idea what's going on out there now, I think that, if you could go out there with somebody like Steph that's really good at working it, I think with all the tariffs on stopping, you know, I think there'll be more people wanting to come build in America or expand into America. So I think hopefully we don't miss any good opportunities, but we'll see. So that was some of the things we talked about at that stuff. And then I had, Central Iowa Juvenile Detention. Detention rates and all that stuff's pretty much norm, you know, same as what it's been. Nothing new there. I mean, too many kids and too many serious, you know, issues.
Have some of the things been worked out there?
Well, that's what that was
I don't
what
know how
our
much-
closed session was about. I'm gonna try to give you, you know, I had everybody read that article from over there at Hardin County. That's there's the insurance for the center hired an attorney in Des Moines, and he's working with them, trying to actually get it taken care of out of court. I can't say very much, but, because it's illegal stuff. But I think it'll get worked through and things will be all right in the end. But we're having to check 28Es and get stuff cleaned up, and I've already talked with Terry some about it. So there's stuff going on. I don't think that it's anything I'd panic about. I mean, I'm not panicking about anything there. It's just some formalities that hadn't been getting taken care of, or at least it doesn't look like they were, and it's just formality stuff, you know, paperwork and what have you.
Do you think there'll be any reform in juvenile detention like we've seen in behavioral health? And some of our,
I'd like to see some. I'd like to see them not really meddle with the kids. I think as far as there needs to be some reform in there inside the buildings to handling
think there'll be any changes in bed space?
well, I'm hoping so. I don't know, you know, that's probably, something we need to be talking to Steve about each week, but, it sounds like they were gonna open up some more, if you take away them spots from Polk or make them start using them. I think that was some of the stuff they, were pushing for. Where we at with that? Nobody was really talking about, everything was about the 28E stuff this week.
I mean, and one thing you do hear, at least you hear from a global perspective, the United States perspective, is that Trump's threat of these tariffs have these large worldwide businesses thinking about putting manufacturing plants in the United States of America that currently don't, to avoid any tariff. So could have that effect also, I guess. You look at it, you always hear of tariffs being bad, I think Trump uses them as a negotiating ploy. That's his first thing to start negotiating with people. But, so it could have that effect also.
I think well, on that point, yeah, I think he actually is trying to push people here.
Yeah.
Yeah.
In particular, I think you'll see him pushing tariffs towards the things that we need here, that we don't want to be dependent upon. Look at the medical supplies in 2020, how that kicked our butts, with, not having it. And then computer chips and stuff like that. I think you'll see him pushing more here. It's just me guessing. I mean, I don't have any insight.
They actually had that on Fox, I think, this morning, that he's looking to get the whole part that it takes to make something, not one thing being made here and something else there.
And Dave, I don't know if you guys remember, that one company I was talking to last year at the International Economic Development, that industry from Turkey, that fella, that's what they did, is they made the computer chips that went into all the batteries, these new lithium batteries and all that. That was one of their primary things but they milled all kinds of other components, but that was one of their primary sellers, is them components. And he was looking for a home, and he wanted to be in the middle of the country so he could buy around from there. I don't know that we would have had the workforce for him. I was trying to say that, Western Iowa Tech and some of our schools, and I'll bet we could even talk some of the other ones. And I mean, it would have been a 400-person factory by the time it was finished. So there'd have been 400 people in there, which is a large number for our community, but it's not so, I don't think it's so large that it would, as they built it, it was gonna take time, they'd be recruiting people in that were different than what our current big industries, utilize for personnel. I mean, been a whole different education level and all kinds of different things. So a lot of technical stuff.
Well, you'd hope you'd be able to draw from other areas, Sioux City, Omaha.
Yeah, well, and that's just it. That was kind of what I was using with him. I said, we're 60 miles from Sioux City, 120 from Des Moines, 70 from Omaha. These are all big urban centers. If you got something like that building, there's people interested and developers start showing up, because now there's gonna be people wanting to have houses. I said, to me, and I keep using this, like I've told you before, is I said, I remind everybody, I said, I don't know if you ever heard this before. In Iowa, we've got this thing, if you build it, they'll come. We make movies about it. That's kind of one of my selling points when I'm talking to some of these people. But he was very interested, but we didn't have anything shovel ready, and he was looking to do it now. I mean, he wanted to go while it was hot, so I'm pretty sure he ended up close to a Chicago or Kansas City or something. We'll see. We're not next to Des Moines, I mean, we're out here away. So there's some things that we're working on, Steph's got some leads on some stuff, and we're working on some things.
I had a gentleman from Manning tell me years ago that, he said, it's all how you look at things. He said, you frame it in, we're in the middle of nowhere, people won't come. But he said, really, think about what you just said, Sioux City and Omaha and Des Moines, we're in the middle of everywhere.
We built a barbecue just to leach off of all three of them. Tri-City barbecue.
Really, today with travel, it ain't nothing
Share.
to travel that far.
Not anymore, and then that's what, and I'll throw things like, we're working desperately to get a new 4-lane built into the area and all these which we are. I mean, that's stretching it, we are.
Stuff takes
So,
time.
I mean, and then I'll talk about the other things we're doing. I mean, hell, I told him about the wellness center, and I couldn't believe how that perked his eyes up, and then so that kind of led me to we're building a new reservoir. We want to make sure we got plenty of water now and forever, and I mean, it would also benefit us in recreational activities and and all kinds of other things, you know, as flood mitigation and all kinds of things that we're looking at trying to protect our area and develop it. And, you know, I've got great hardworking people. It's everybody here knows how to run a shovel, you know, so I mean.
We have good hospitals, good schools.
So I mean, that's some of the typical things we were selling, or I was selling.
And it's perspective, because the people from the city, they travel in, distance or in, time, and we travel in miles.
Yeah.
And so for them, it's no big deal if they say, oh, it's just 45, 50 minutes, you know, for them to get through town or
Yeah.
whatever. Traffic was good today. It only took me 45 minutes to get home.
Yeah.
You know, it's no big deal, where I could tell them in an hour and 15 minutes, I can be unloading at the airport in Omaha. You know, I can be to get out of my car and
Mhm.
When I
be
was
at the airport. in an
2
hour and
weeks
15
ago,
minutes.
I was down in Dallas. I unloaded in Garland. And I had to go 15 miles to my other load in 3 hours. Cause of the damn construction and stuff, the roads were so backed up. I mean, and it took and there was also a wreck that day, but you know, I mean, I think they probably have a wreck every day.
Everything.
You know, I mean, and I thought, God, if I wasn't in this truck, I'd be on back streets. I'd say, I'm fine with the stoplights. I'm getting there now, but you know, I don't know when, you don't wanna get off somewhere you shouldn't be, you know?
Right.
But,
Right?
yeah, I mean, that's right. 3 hours can get us way past Des Moines, you know? So, yeah, you're right. And if you get some of them high-speed roadways, you know, and the other thing they've been asking a lot about, you know, and I've talked to people like that, and I've talked to a few actually subsequent that I've called back. I got all them dang business cards, you know? And, they asked me about our airport, you know, I mean, you know, but you're talking to CEO type people. I mean, maybe they want to be able to fly into their business, you know, and I really don't have the answer what size aircraft. I mean, I know we're not gonna land a 737 here. They need a mile strip. You know?
Supposedly though, I thought this was in the works for Des Moines, that they are going to become a regional hub for Allegiant.
I think you're right.
And it's gonna be I think the construction's actually already underway.
So they're building their hub
It's supposed to be a massive, massive upgrade
So,
for Des Moines.
for Des
pretty
Moines.
much.
Yeah, but they're still asking about like, what do we have local?
Right.
And I think our goal we should always keep our airport in our mind for a goal. We want to try to someday have a mile strip. I don't know where you're gonna put it out there, but you know what, if you aren't, like you said, you gotta keep looking for the future.
I mean, they put a new runway in and they're gonna concrete that. That's still in the plans.
How long is that? I don't know.
It's great.
I mean,
Great
you
question.
at least wanna
I
be
don't
able to
know.
get them corporate type jets on the ground, I think, if you're wanting to start bringing people from overseas, cause they gotta fly in and.
Well, I wonder even how airports will change in the future with what you were talking about with the drones and having drone hubs that basically bus people into the city
Yep.
and back out. Then maybe the landing strips won't be as prevalent.
Yeah, well, quite possible. Then it's easy. It's
You don't know.
instead of an hour drive to Omaha, it's a 20-minute fly. You know, you might have that for your in a drone
I don't remember
taxi.
what company it was or what you,
Yeah, I can't remember the name of it, but I came back with that from the
Mhm.
summer conference. Yeah, it's,
sounds wild, but
you know, we're moving fast. Our 5,000 year leap's really it's got a lot quicker. We're on the next 5,000 year leap.
I just wanted to squeeze in, I did a little research last night on dental plans, kind of, talked to a few people. TRICARE is one that some are looking into, and Aetna has a plan. And, Blue Cross Dental Insurance, was brought up, so I think there's other plans out there rather than Delta Dental. And, what the problem with Delta Dental is that they don't pay what the providers need, and it just doesn't work financially for them to have a dental plan that, you know, let's say a filling
Maybe the
is,
providers are charging too much.
right, well,
Could be.
but
Very well could be.
it could very well be, but the overhead, you know, it starts way up here, you know, of what it takes for a dental and a dental assistance and the chair and everything. This is what that service costs them.
I know I was talking to Amy a little bit
Okay.
about it
Yeah.
too, and
Yeah.
Aetna is,
That's the one I was gonna say. I
Aetna
think I heard that
is
name.
worse service and more cost.
Well, Blue Cross Dental Insurance, I kind of wanted to know what the city of Denison was using, and then, the mayor is very tight with, dental, and so, she did bring up the TRICARE, but I don't know if I don't think that would work here, cause it looks like qualifications, but I'm just.
TRICARE is a military or a
Yep,
veterans,
that's what it
right?
is, yeah, so she, it's TriStar, maybe she couldn't think of the name, and so,
And TRICARE's us.
yeah,
Yeah.
yeah, so, but there's other ones out there, I guess, is what.
But on the other hand,
We'll have to research
if the
though.
providers are charging too much, you know, that's a business decision they made not to accept that Delta
Right,
dental.
exactly.
And
It's gonna cost
It
them more
is.
it's gonna
money.
cost them if all of a sudden a lot of Crawford County employees go to Carroll
Right,
or wherever else.
and it's a distinct
I hate
possibility.
that, but.
Cause
you
it'll
gotta
probably still cost them less if if a provider is charging more than the standard. You know, I mean, I don't know, we have two dentist offices, I'd be curious what both of them charge. Say for a set of annual x-rays or whatever, you know what I mean?
I almost feel like it's going to take a team to vet, you know, what the pros and cons of all of the other ones are and some research, because we can't go without dental, some kind of dental coverage, because it's.
Right, and we're not going to go without dental
Yes,
coverage.
so I guess my reason for
People
bringing it
just have to
up.
make a choice, it's always a choice.
Well, what, are we gonna offer
Right.
something else? I guess the reason I
So-
brought it up, because.
Right. And the other side of that is, are we going to look at changing our dental coverage and possibly exclude the other dentist that is in town and not having an issue with billing to Delta?
I just bring it up because I
Just
think it's
saying.
something that we need to really stay in front of, because it's a benefit that we offer, and if Delta Dental is no longer accepted at our local, we really should research, and so I just thought I would bring that up, that it's still at the top of a lot of people's minds, because
Well, I'd be curious too, going forward, what the response is from the employees, if they just make that choice automatically.
Maybe we should put out a little, could Amy put
Or-
something?
Probably,
Well, it's
she's
one-
probably already heard from a bunch of them.
well, and that's kind of, I really think that we
Wanna
need
hear
to
from
stay in
her?
front of it.
Later?
So that we don't get
Maybe
caught
we'll
up
send
in
it
a
out.
time crunch of,
We'll
need
have
to
a
know
little
today what
time.
we're gonna do, because we're getting ready to. So.
Yeah.
I will.
Hello.
Kind of
Sounds
see
good.
other, municipalities and see. what's
heard-
going on.
Concrete runway is 5,000 feet long, 75 feet wide.
What would you do without your computer?
The current one.
The current one.
He would
not
just
the-
open his thesaurus.
He's a roving reporter on the go, isn't he?
He could probably just pull.
Fox News needs you to.
Real
We
quick,
don't even fact check him though.
Paul, before you get started,
So, you know better, right?
I have one thing that, quick mention before we get started with Paul. Ellen Hansen did text me yesterday. He went to your office.
Yeah, we got some stuff to get
And he said
started.
he got enrolled in some Iowa State
Awesome.
Extension out, so he is
Okay.
doing what he needs to do to be our.
Excellent.
Super. Nothing but good news today.
Go ahead,
So,
Paul.
Okay.
welcome back.
Yeah, you bet. I got a number of fiber permits. Most of those are Mid-American, or all of them are. Just connecting substations. So unfortunately, it's on several miles and quite a few miles that we had fiber on last year as well. So I guess, we just have to continue to work with them. Connecting the world. The other items under contract work, just waiting for the lettings there. So that's kind of where that's at. The bridge crew is out working on the dock out at Yellow Smoke. So if you wanna go take a look, 12 inches of ice is a perfect time to work on a dock over water. So that's moving along. The part-time summer help, we did get a number of applications, so we're gonna, try to get those things locked in and secured and get our guys in place for the summer. The purchase of the semi and the trailer, I've got it in the budget. It's in those numbers there. So, if you do feel comfortable, if at some point, I know you're still doing budget workshops and you really don't know where you're at for sure. But when you get to that point, if you're uncomfortable with that, let me know. If you're not, that's fine too. But the sooner I can get those ordered, the sooner we can get them covered. So just to let you know. So, and our spray truck, I got an update.
Yeah, you can come right.
With that, yesterday, that was, built, the build date's February 8th, so that should all fall into place. That's for the spray truck. So they deliver that to Washington State and then our spray company picks up on that and takes it, puts the spray equipment on the chassis and ships it out here. So we should have it in May sometime.
Be great.
Everything falls into place. So I did just shocking. I got a detour agreement for the Buck Grove pavement again for March of 25. And I had to take another look at this. I just got this email and I was looking at it, what is this? Through November of 25 for bridge work on US Highway 30. I had no idea that we're doing this.
Wow,
Which bridge is this one?
that's their
One just outside
detour.
of Dow City. See, the river crosses.
The one
up
that's
that-
just this
And then
one.
it crosses back over just outside of Dow City. I have no, so I got a phone call into the person I got this from, but, I don't know what's going on. Anyhow, I really don't. I'm just looking at this saying, what?
Well, at this point, we should have made them pay for half of that new pit.
That's what I'm thinking.
They're spending more time on the Buck Grove pavement than we are.
Yeah, but anyhow, so here's obviously here's the map that they sent with it, and the bridge is right here, here's Dow City, and, obviously that's the detour route, all that traffic's gonna go up on Arion Avenue probably, or try to sneak around there, the locals anyhow, get north, but yeah, every once in a while you get a bombshell dropped in your lap and you don't know what to do, whether you should pull the tab or not.
Yeah. Are you in the mood for that today?
Had no idea. I still am a bit puzzled because they're going to all this work to do the public input for a project 3 years out on the other one. And this
then
thing
you
just
throw
all of a
this
sudden
in,
comes
and then
out
it's
of the.
still
out of
March
nowhere.
clear to November.
Well, it
surely.
starts here in another 6
Yeah.
weeks.
And that's basically 2/3 of the year.
Yeah,
Wow.
anyhow,
To be continued.
yeah, so we'll see what happens, what's going on there. That's really all I have.
All right,
I can catch my
okay.
breath from this.
Yeah.
Cause I don't remember them asking for public input on anything like that.
I've never heard anything about it.
Not this one, no.
Mm-mm. This is the first I knew about it when I got this email.
Cause you saw, I guess, and you saw that, I forwarded on to
Yeah.
you the response that I got.
You did, and I responded, I think, several people responded to it, and, I got all that in the file, I thought this is really good, they're being very, awareness, like people know that, all of a sudden I get this one. I thought maybe they're just doing work for a week or two. So I don't know, I gotta find out more about what's
Okay.
going on, cause I really don't know, but there's a pretty big time frame in there, so, yeah.
So huge time frame.
Yeah, next Wednesday, we're having the safety action plan workshop. I think Kyle sat in on the local roads safety plan workshop that we did a number of years ago. And so, these can generate some substantial funding, because the local road safety plan, we were able to, get almost $2 million now total in grant money because of things that they identified as safety enhancements on our roadways and all of its paved shoulders, zipper shoulders, rumble strips and safety edge. So, we've implemented almost everything in that local road safety plan, or will have by the time we get done with L 51. So this is looking at, curves, maybe, more specific areas and things that can be done, but we've done a lot of signing, we've done a lot of the things that we can do, so. But it brings together, law enforcement, EMA, fire department, Tim's gonna be kind of coordinating some of that. Schools, talking about, not only safety from an engineering standpoint, but safety from a culture standpoint, from operation standpoint. So you're all welcome. I think I sent these out. I've got extra copies if anyone wants one. We're gonna pass them around there. This one is.
It should be coming to your email.
Yeah, so, yeah, we're trying to forward it out to everybody, so.
Did you link Zach?
Not yet. Kathy has it on her email, so we're gonna push that out here later.
Okay, please do, because I think that'd be good to have.
Yeah.
Yes.
So,
Think all you told
If
Tim.
it's got grant stuff, we want him
Farm Bureau.
to.
yeah, Yeah, him and Ben are both gonna be there that day.
Wednesday, February fifth?
This is Wednesday, next week, February 5th at 8:30,
Yeah,
right
I'm going
here,
that day.
right here, in the
You
conference
must have
room.
dreamt all this and made it
In
happen.
the courthouse. So, I mean, there's no requirement. Kyle was the one that, you could maybe designate one board member or somebody that, comes to it. If you're all welcome, but you don't have to feel like.
Was it in the conference
It'll be in
room?
the conference room,
Got it.
yeah. Next Wednesday, so 8:30 to like 11:30, they'll have kind of the group meeting and then they have lunch, and then after lunch, it's more just talking about specific projects and the engineering side of things. Okay.
All right,
Excellent.
I'll email you when I find out more on this detour.
sounds good.
All right.
Thanks, Paul. Thanks,
Thank
Dan.
you.
Yeah, thanks, Dave.
Now, if Taya's out there.
I can look.
I'm gonna-
I'm gonna take just a minute or two.
You do what you gotta do.
I'm old.
We don't have the times on these.
Okay.
At night, conference board, nothing in the morning though.
I'm gonna be like Terry's.
I've got that confused, but
I don't think nothing in the morning.
maybe I just got that.
10:15.
Seems like it's-
10:15.
Oh, well, we didn't put a time on it. Yeah, she might be here a little earlier. Yeah.
Well, we can continue with other things. Nothing says we can't. I'm going to, go talk to Amy for.
We take a little 5-minute break?
We are.
Okay.
Yep, we're on break.
That's it. That's
Potty
the
break.
difference now that Dave's the
Where you going?
chairperson, he likes to take a little break once in a while.
I can think about it.
That's good for you, Chief. That's good. Chop, chop. Chop, chop.
Running behind here on installments.
Well, because I will head.
What's that?
I will head out.
Are you? Well, thanks for stopping by.
Yeah.
Keep an eye on the kid and make sure he's staying at it, right?
You know what I realized because of my life and where I've been with the whole political thing.
Yep.
The dedication, the time that people don't realize each of you put into it,
Yeah.
so I appreciate that.
Yeah, you've had multiple generations of it, you
I
know.
have had.
It's nice to see though that people are engaged and passionate in it. I
Right,
got a young fellow that's considered my oldest grandson. He's gonna be getting married for their anniversary or for their honeymoon. They wanna go to Washington DC. He's very into the political spectrum. For a truck driver, he's awful. I guess maybe he inherited that from somebody. I don't know.
right.
In any event, he wanted to know some places and I told him, I said,
Just sit your foot on the ground, you can't, there's no time, place out of place.
there's so much to see out there. He said, and then he asked me, so what's your favorite place there? I said, place that not very many people talk about, but the archives is my favorite. I mean, I could stand there all day and stare at the Constitution and the Declaration.
One of my relatives signed, on the mom's side, signed the Declaration of.
Really?
Yes, Samuel Chase.
Is that right? Awesome.
Yeah, it's kind of like right in the middle.
What?
Beginning.
And.
Sure.
that was
Fuck
for
that,
the-
only
Yeah, we can do that.
the Philadelphia's really cool,
That's where NACO's at this year.
yeah.
I'm excited. I've been to Philadelphia countless times, or through it, I should say, but I've never been able to check things out.
And
I'm
as a
excited.
state representative, and we went out to our nephew's wedding out there.
Excellent.
And, he did his report from like where they signed the Constitution and it's a very neat area, but.
It is.
I'm really looking forward to this, the trip out there this summer.
Well, carry on.
Yes, ma'am.
Thanks for coming up.
For stopping.
You leave right after the state?
No, we leave tomorrow morning.
Okay.
We got budgets all day today.
Oh, yes, thank you.
Our
Always. Our favorite subject.
So, dental.
Yes, so did you get a letter? Did everyone get the letter?
I did.
I don't know who it's all on, but anyways, so the last time I went to get my teeth cleaning, I heard from Broadway Dental that, as of April 1st, they were not going to, submit claims. Well, they're gonna submit claims, but you have to pay upfront.
Mhm.
And then, the claim, they will submit the claim, but then Delta Dental will reimburse. And I was like, okay, and so
They will submit the claim.
they will
They
submit the
will,
claim,
okay.
but the payment will come back to the employee. So I asked, so if you're not gonna be a provider anymore, obviously you get discounts. So what will the employee be getting back? Or, you know, like right now, if I get a cleaning, it costs me nothing. So if I have to pay you $150, am I getting $150 back?
Mhm.
And they're like, well, we don't know. We basically have to wait until after April 1st to get claims submitted and reimbursements to see what's happening. Okay, well, can you tell me how much a cleaning would cost? Because next time I come in, I have to do my x-rays, bite wings, you know, all of that stuff. So how much is that gonna be and the cleaning? Well, you know, prices change, so we really can't tell you. And I'm like, but you're wanting me to come in with $800, $1,800, like how much money? Give me a ballpark, so I know kind of how much money I'm gonna need. Well, and I'm like, I'm like, all right, and then I got a letter from Broadway Dental saying that nothing was changing, whatever, and I'm like, well, things are changing, and you can't even tell me what's changing because you have no idea what's being paid. So I talked with Holmes Murphy because because the dentist came around to all of the companies uptown and said, you know, Aetna will do this, you know, Aetna's a great option, blah, 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 this is a great option, and we're gonna be doing our own insurance, like in-house, and I was like, that's weird, okay? So I called Holmes Murphy and I said, you know, first off, can you tell me how many employees are using Broadway Dental? And the number I got was 50. I don't know if that is 50 employees or 50 like participants, like, so that could be family members. But if it's 50 employees, then that is about half. That's on our insurance. And we talked about Aetna and that kind of stuff and the other options, and they were like, listen, Delta Dental, Wellmark are the two top with rich benefits. You would be doing a disservice to your employees going away from them because first off, your rates would be more. You know, rates would cost more to the employer and your benefits won't be as rich.
Lovely.
But Broadway is basically saying, you know, Aetna, at least they'll reimburse them. But if they're still not a participating provider, the rates are gonna be different. So I asked Holmes Murphy, because this is self-inflicted. Broadway is the one that is pulling away. So this is self-inflicted. It's nothing that the insurance carriers are doing.
Yeah.
So I asked Holmes Murphy, have you seen this? What is going on? And they said in southeast Iowa, a whole bunch of dentists got together and is doing this. So basically they're trying to fight because, you know, just like any insurance, they're saying, okay, if you do a teeth cleaning, we're gonna pay you back $100. So, well, they wanna charge $150 and not be told by the carrier how much they're gonna be paying. So in southeast Iowa, it's working because everyone did it. But up here, they're the only ones doing it. So I don't personally think it's gonna last long because I think they're gonna lose a lot of their patients. For one, they're gonna lose me. But because why would I go there and have to pay up front? Who, Lord knows how much, and then not know how much I'm gonna get reimbursed when all I ever get is a cleaning and x-rays.
So you're
That's
saying
free.
even as an employee, you'd rather keep Delta Dental and go somewhere else?
Yes.
And even if you had to travel?
Well, all I will have to do is cross the street.
Well,
But yes, I mean, and that's the point. You literally can go across the street and
Dr.
Not
Bigness
have to-
might not have enough people on hand to help.
maybe he'll staff up, Right.
I mean,
Expand his business.
because,
Let me tell you, if you leave a dentist, especially over something like this, you probably won't go back.
well, I mean,
so
yeah, I
essentially
mean-
what you're saying is time may fix it all itself.
Right, and I personally think it probably will, because again, the reason why it's happening in southeast Iowa and why it's working is because all the dentists came together and all doing this. But I called 32 and U and asked, hey, are you changing up? And he's like, nope. So if they're not all doing it, you know, and still even in where we are, we could go to Sioux City, we could go to Omaha, we have a, you know, in an hour, we could go a lot of different places. So that would be a lot of dentists that would have to do it. So I mean, I'm sad. I've been at Broadway for 13 years, so I'm sad to see, and I love Dr. Slossman, you know, so I'm sad to see this, but I mean, taken my personal account out of it, going away from Delta Dental when they have such rich benefits, and you can look back at all the quotes and all the years that we've gotten from other dentists or other dental carriers. Delta Dental and Blue Cross always kind of compete with each other on the rates. They are the best rates and they have the best benefits. So, and we just did that carryover thing, which is huge. I mean, I don't even know if any other carriers do that. So if you don't use it, it kind of, you know, rolls over to the next year. That's huge.
I think I had to pay like 10% on my crown, which is a lot less than the crown.
I think you make a good point too, Amy. It's nothing that the insurance company, now, if they did something that they didn't wanna cover us.
Right.
It's different. This is a business decision by a private company. You know, we can't change our model every time
Right.
Yep.
something like that happens.
All right,
So we have to stick with the best
I think
insurance.
it's
that
best to
benefits
let
our
everybody
employees.
know.
yeah,
Yeah. I mean,
You might wanna find a new dentist or
I got a
Yeah.
letter from
Wait 'em
Delta
out.
Dental, is who I got. the letter
right,
from.
yeah, and you should have gotten something from Broadway if
I got
you go to
something from
Broadway.
both.
I do.
I got a letter from Broadway and a letter from Delta Dental. And I've had a lot of employees call and ask, you know, kind of what's going on.
That letter,
And so I have been, you know, if they ask, I have been kind of letting them know what I have
Okay,
learned
very good.
and
So are Delta Dental's amount that they pay different for in-network and out-of-network? For now, Broadway Dental will be an out-of-network provider.
yeah, and that's kind of
So
what
that
bothered me.
Reimbursement rate will be different.
Right, and that's
So-
what bothered me is they're saying that they told in that letter that nothing is changing, and it is.
So you won't get back what you paid in.
Oh.
And the thing is, they can't even tell you what it will be because they have no idea what the reimbursement will look like. I mean, cause I asked them, if I get a
Can
cleaning,
Delta tell us for a
well,
non-provider,
let's
you know what I'm
see,
saying?
they
I
must
suppose
have-
it depends on what they
but they
get
wouldn't know
charged.
what they're charging, and that's the unknown in our equation.
Right, and so I had, all of this conversation was back in November,
Mhm.
because that's when I learned about it. And Delta Dental hadn't even heard from Broadway that it was news to them that Broadway was pulling out. So
Oh.
they couldn't tell me anything because they didn't know what was happening. But obviously now they know, so I could
Yes.
probably call and ask and get some questions or get some
I mean,
answers
cause like,
now.
is it just a percentage of what you end up paying? Is it, you
Right.
know what I mean, and
To me,
what
that's a
potentially?
service employee, because not only do they have to front that cost, then
Right,
they have to carry it until they get reimbursed.
Right.
Right,
then they
and
will
it's a
take-
partial reimbursement.
And a part, yeah.
Yeah, and seriously, a cleaning, you go in, you want them to be getting their cleanings twice a year because it's free. There's no charge to
Right.
the employee,
It's
and that
preventative.
is preventative maintenance. And you want them to do that.
that's when they catch the little ones.
Yeah, and then when,
The big cavity isn't a root canal.
Right.
right,
Had 'em all.
so,
Well,
yeah,
good year
Yeah,
on top of
thanks
it.
for-
Thank you,
Well,
Amy.
Thanks for the
Just
update.
I
from
did
purely
not.
business perspective, you stay with Delta Dental right now.
Right.
Yeah.
And then
Okay.
see how it
You
works
might need to
itself
find a
out.
new store to shop at.
yeah.
So I'll just stop doing any research on a place to go, cause that I didn't know which direction we we're gonna go, and kind of worried me that we'd get to the end of and not.
Right, no, I get that.
So
Yeah.
I wanted to keep
Yeah.
that in front of us
Yeah.
until so I think that's okay.
Yeah.
Thank you very
Yeah.
much.
Yeah, no problem.
Thank you,
All right.
Amy.
And I did just get an email, I think I shared it with you.
Oh, okay.
The IGCHP
Really, I mean, Doug
confirmed
was-
that our renewal is 0%.
Oh,
That's
yeah.
the first time in my whole
Right,
life.
only maybe that $5.
Yeah.
Only
yeah.
the administrative
Yeah.
cost is peanuts.
Right,
It is
exactly.
peanuts.
It is.
Compared to the zero, I mean, that's huge.
Yeah, that
Right,
is-
and we'll know that probably next week. Is that when that conference is like the
Yeah.
5th or
We do kinda
6th or
have to know
something?
that.
5th again.
Yeah.
Great news.
Yes,
Yeah.
I was like,
Keep the
never.
good news coming.
Yeah, I was like, never in my life of HR have I
know.
ever seen a 0% increase or,
It's
you know,
stellar.
for a
It's so
renewal.
good.
That's
That's-
huge. And she said, this is the third year in a row that it's been 0%.
Cool.
And she said, welcome to the party.
All right.
I was like, just like everything, we're late to the party.
I know, exactly.
Well, good news and thank you very
Yeah,
much for,
no problem.
Thank
Fashionably, like,
you.
we're still at the party.
at least we made it to the party. I'm just-
Paul, you got something for us?
Yeah, I just had a phone call with,
Oh,
DOT staff. And yeah, they're doing a complete deck removal, replace, approach slab, replacement guardrail, similar to what we did on those bridges out here.
Whole brand new bridge.
Basically, yeah, it's gonna be months. And so apparently what happened is the design group in Ames or whatever, the central office, this project got advanced because another project had fallen through, so that they advanced this project sooner. And I said, well, this is gonna really impact a lot of people.
Well, I'm gonna tell you, on our Highway 30 stuff, they actually come on and talk to us, and I thought that was a 27 project.
Well, I said, this is the first, that email I got 25 minutes ago from you, this first time I had any knowledge of this. And I said, you're gonna have a lot of people that are gonna be wondering what's going on.
Especially after that letter that came out on the last one.
Yeah, I said, I was telling everybody how proud I was of the DOTs. Advance notice, preparing, and now here, just, a few weeks later, I get this, but that's what's going on. So I requested a meeting with a field meeting before we sign that agreement with the, district engineer or one of his staff members. We go out, take a look at what's gonna do to our roads. So it's a real deal.
Okay.
So that's what happened.
All right, thanks, Paul. Okay, we're ready for you.
This is the one that's on Anderson's.
Oh,
That railroad bridge. And he's talking about, right? where there's a
Good morning, good
house
morning.
Sits there.
If I know exactly, I just had to make sure.
Hi, Taya, how are you?
Good, how are you guys saying? You moved chairs. I noticed things.
Yeah,
Oh,
well, when that,
well,
when it
every
gets
year.
somebody new there, we just kind of fly around.
Oh, okay,
Don't
By
be
the time
bored.
I'm done, I hope I sit in every seat.
I've never
Okay.
got to that half of the side. That's kind of the.
4 years, I've never made it past
It's
there.
the
I've
stellar
got these
side of the
three
table.
chairs covered.
I don't wanna sit that close to Terry.
I don't wanna have to be in charge of
I
pointing
got
out the
good long
map.
arms. I can get you.
Cause I can't see it.
Craig's safe. He's
With or
out
without
of reach.
glasses.
Kyle's our official pointer guy.
I know, he's got to stay there.
I was just open.
You can bring a chair on up and sit right up there. Absolutely. That's what we have, we need to put wheels on those.
For myself over here and trying to figure things out.
Join the party.
This is Nika. I don't know if I've ever brought her.
Once.
I
was-
It's been a
Very,
while.
very beginning.
She's the one that does all the prevention with me. So I figured we should bring some stuff to show and tell.
I love
I
show
like
and
that.
tell.
So one of we've done a lot of the prevention stuff in Manning, kind of our focus. I've been talking with you guys. And we've spent a lot of times in the schools, teaching teachers and students. And one of the things, so Nika and I got involved, mostly Nika now, I've kind of sacrificed her to most of those things, with AC4C, which is a statewide prevention program. And one of the things that they did, we were teaching people about like vapes and hidden vapes. And they gave us some supplies, to kind of start on. It's called Hidden in Plain Sight. So they got us a bunch of supplies that kids are using that look like normal things. And I don't even know how to use this. You're gonna show me.
So this one's normal.
Oh, that one is normal.
This one is.
That's why I brought Nika along.
No bacon on that
Give me
one.
a class on how to use that.
These kids, they could pull everything over me.
I mean, it still
So it
marks
works.
and everything, but with this one, it's a pipe,
What? Get out of town.
but they have it closed up so you can't actually use it, but it's pipe.
Yeah?
I mean, it's still, oh. my
So
marks
who's
is-
marketing that? Just,
Like some of the
You can get
stores,
some
some of the.
Oh,
Like you just start Googling these things.
Oh,
So this one, it's a pen and it won't write because it's a piece of paper, but
It's, yeah.
Oh.
so they,
Are
there's
you-
nothing in this because I have terrible lungs, so
get out of town.
you just open the top and,
That's insane.
so this is one of them.
Oh, yeah, there's, when
I have to
AC4C
know.
started telling us about this, I was like, oh my gosh, as a parent, and I even spend my time in this field, I don't know anything.
So I mean, if you saw this in your kid's bathroom, would you?
I'd be so proud.
Yes, yes, that's where mine went.
know.
That's
You'd
where
be
mine
happy,
went.
Hallelujah.
but
That's where mine went, but
It's a stack, nope, it's just a stacked one. You take this off
Yeah.
and
It's not
hide
even
stuff in
real.
it. It's not
Mm-mm.
real.
Oh, my. Does it-
Same,
is
You
that-
can get
does
that
it smell?
some kind of stuff
No,
like that.
okay, I
for
just-
a little bit, just,
Yeah.
Yeah.
Hide your
Hide
jewels
your,
in.
just
hide
be
your,
curious.
yeah, precious.
yeah,
I
this
would
one's
think
the
it's
same
fake,
thing.
but
Yeah,
it has
I would
a
not know any
fake,
difference.
Yep, nope, that would, so I won't try to find the fake one, cause it's a
Want the
little,
hat?
So we've started,
dynasty smart.
That's
now that,
cool.
you know, we've done one round or two at certain schools and done some stuff. Now that we've got this stuff like this hat, like I wouldn't think much of it, but there's a little pocket in here.
That's a map pocket.
Yeah.
Well,
the
that's what it's
soldiers
supposed to
call it.
be
Yeah,
for.
exactly.
That's what it's supposed to be for, but man, these kids, not just kids, I shouldn't say kids, adults and stuff, they can get lots of things in here, and like even our recovery center, we check things a lot, and I have always, because of the recovery center, like I've always pulled off deodorants and things like that, but I can't say I've ever ran my hand inside of a hat
Or chapstick, I mean.
or pulled out chapstick, cause the bottom pops off and
I don't got nails, but.
there's stuff
And
in
normal
there.
chapsticks don't do this, I did double check. My Sharpie again, it marks, there's
Yeah.
nothing, but
Just untwist it.
Oh.
I twist it.
Yes.
And I do have a regular
So
Sharpie
does that one
too.
work in reverse when you show kids these things? They're like.
So we don't show the
I don't
kids
show the
these.
kids these.
We
Like,
don't
this is a
show
normal
kids this
Sharpie
stuff.
here.
I need to get me one of them.
Yes, yes.
No.
So we don't show the kids, anybody under 21, we don't show any of this
Okay.
stuff too.
Nope.
This
But you
is,
can't tell the difference between
we don't
them,
need to teach the kids how to hide things for
I
us.
did make a mark on the bottom,
so that you know.
so I know, but if those
You
were
can't-
just,
They're right.
yeah.
Well, that's market infringement. Somebody should go to jail.
Somebody should,
Somebody
but
should go to.
there's a lot of,
That's a spreadsheet.
Everybody's wearing those.
Everybody's got,
Oh,
all the
yeah.
girls have them.
Yeah,
Oh,
but there's a,
some have
they,
pockets.
they were
Pocket.
designed, you know, like some of these things, like this was designed for runners to put money or their keys
Yeah.
in. Well, it didn't take long for people trying to sneak things in.
Try to figure,
Right.
figured it out.
So a lot of this stuff is marketed for different things,
Purses, yeah.
different purposes, but then
My
utilize,
patrol cap. I
yeah.
mean, you had a map, and that 1982 is when I was, and they probably had them in long before that. So I mean, that's,
airbrush.
Say my head sweats too
I
much.
never
I can't
thought
put
to
nothing
put
in my
anything.
hat.
It's glass.
It's a flask.
I'll be
I'll
damned.
be good, heck.
So we've,
That's for taking to football.
I mean,
How do you know
I
that?
think back to my college days about how I
Hide
got
brushing his hair while he watching football.
Iowa State Stadium many a days.
This
But
one's always there.
Yeah, I definitely could not take that. They would think it was something.
Yes. Yeah, what do you need a hairbrush?
What do you need a hairbrush for?
this one we bought in Carroll
And Carol.
at the vape store,
At the-
at the vape store.
That's what I
Vape.
wondered at the vape
It's
store.
a
have
vape.
stuff like
Yeah,
that.
Put the liquid in here.
We bought this at the
Like
vape
that?
store, well, she bought this at the vape store in Carroll.
And you thought it was a coffee cup.
And like some of these things, when we go into schools, like before
Oh.
Nika and I start talking, she'll set out like a couple, like the coffee cup and a couple different things. We just kind of set out with our stuff to see if anybody can pick up on it.
They never do.
And yeah, most
We
people
never
don't.
admit.
Most of the kids don't know it.
We don't show this stuff to the kids, so
Oh.
we only show this stuff to the teachers
To the
and
teachers,
parents
so
when
they
they
know
do.
what to look for.
So they know what to look for, we don't show children
But
this
the
stuff, we don't
teachers are
even,
naive as we are, I suspect.
yeah, like they've all like heard about like hidden vapes and some kids really don't try that hard to hide things and just have the vapes in their pockets. But some do get a little bit more creative, and those types of things. The highlighter ones we heard was a big for a while, but we couldn't get them online.
Yeah,
Can I
look at
try it?
that.
Yep.
Just
The purple
So
one's real.
one's real.
That one's just a highlighter.
It's
yeah.
just to show the difference and
Don't
then.
paint your lips. Have you seen
Yes,
much
there is a
change from
difference in
vapes
weight.
to the nicotine pouches?
Oh, yeah,
Oh,
yeah.
I do have
We,
big
so
nicotine
like,
pouches.
we just have some examples of actual nicotine pouches.
Cause I've heard
versus-
that they're starting to take off more so than vapes.
I
I
think
think
this is what
both,
it
they're
looks
easier to
like.
hide. And
Cause they're
technically,
odorless and there's no,
yeah, no,
This is a.
Right.
they're a lot easier to hide and
it is.
I mean, you
they
take
don't,
a,
like when you're chewing, you have that big old dip in there and you can see it, these don't. So yeah, the nicotine pouches, and a lot of them come in containers that don't look like this, that look just like a pack of mints or gum.
Yeah, this is an actual pack of mints, like it's not open, but
But they, you know, how easy to pop that open,
That's a
dump all the
real
mints
mint.
out.
Yeah, these are real.
Dump the
I
mints
haven't-
out
they aren't
and put these
open.
packages in there.
You basically look for that.
So do nicotine
grocery
patches
code
come
on
in
that.
different
Yes.
strengths
And-
or different?
Yep.
But I
Oh,
mean,
okay.
Pouches, patches, all
a
that stuff. They do
normal
come in
vape
different
compared to the
strengths, cause
pouch.
ideally, you know, the purpose of
Which
those is
one's
for
easier
people to
to
stop
hide?
smoking, but, you know.
Sometimes it takes you the
So
other
that's a
way.
big
Yep,
thing?
yep.
No, this is a nicotine pouch.
So do they 100%
So-
dissolve the nicotine?
No, no, you have to spit out this
You
white
have to
thing.
spit something else?
Yeah, so my patients use this since they can't smoke. We have a lot of these. And when they start spitting them on the ground, I see this and then we have to have a whole little come to Jesus talk.
But unlike tobacco or chew pouches, they swallow, they don't with those, don't they?
So they should be spitting them out, cause it's bad on the stomach, but they can swallow them if they're trying to hide them. But yeah, it's just like
When they're small
swallowing
enough.
gum and everything
Yeah.
else. It's really bad for the stomach. Most patients that I actually use those with to try and get them to stop smoking, spit them out. But they're easy to hide. You know, a lot of times you can't tell they're,
Never chewed.
yeah,
But I told
We
him
all
which one is easier to hide.
yeah. Like
When you're trying to get your fix.
Right, and then this cloud of smoke that follows you when you're vaping, you know, and
Mhm.
I see it, I've seen people in Walmart.
Oh, yeah.
Oh, yeah.
Just,
Oh.
and then the smoke, and I'm like, what are you doing?
And they have it
Are you
in
serious?
the grocery cart.
Just kills me.
Lots of things. I mean, our goal isn't to help really hide adults to hide things. Adults can do whatever they want for the most part. But the goal is to, one of the things is to educate parents and
What to look for.
children what to look
No,
for.
You can actually buy
That's
a
a new one
Stanley
today.
cup.
So there is a cup that looks like a Stanley that has a vape in it.
You might wanna take a drink, it might be a flask.
Yeah. I know, like my kids, they bring their own water bottles to school.
Oh, everybody has. a
And my
water
daughter
bottle.
has her little fancy little
Oh,
cup.
yeah.
So, I mean,
Everybody's
who
got it.
knows?
I know.
I mean, vodka in a water bottle is,
Exactly.
I do have a
Yeah.
water bottle.
yeah, this one has a
It's a
hidden,
real water bottle.
Yes.
it is a real
It's
water
a real
bottle.
water bottle.
But it also,
It's just,
That's to put your, protein mix in.
it's supposed to be.
Just telling.
But yeah, it's like, nope, it's a real water bottle. I can drink out of it and everything, like.
Oh, yeah.
And a lot of these things, you know,
Yeah.
we wouldn't
Wow.
question, so.
Yeah.
This is kind of new for us. This is one of the newer things that we've gotten. AC4C actually got funding for this, so we did not have to pay for any of this stuff, which was very nice. They got us 2 sets of it. And so we've kind of started using these things. There are additional, stages of this that they have in the areas. There's none in our area. A lot of, bigger facilities, bigger places have like a trailer that they have set up as a bedroom, and they will put it out at events for parents to go through and kind of see
What to look for.
what to look for, things like that.
Potpourri in the drawer isn't potpourri.
Potpourri in the drawer, no oregano in the closet, none of those things, but they are kind of cool. We've seen one, and they set them up, but, so something we've kind of had in the back of our mind, is that something we want to do in this area? Is it something that'd be beneficial? I don't know. Just things we're looking at. We're starting to track a little bit more statistics in Manning, just, trends always, we're always looking at trends, seeing what's moving, seeing what's going, trying to see what we're seeing in the adolescent population, and kids aren't always as truthful as we think there are, so we're always looking at things, trying to see where we're moving with stuff, and this has been kind of neat for, some of the adults to see.
Eye-opening.
Yeah, yeah, and some of it, you know, like I said, it's all marketed for different things, the intentions are not what, most of the time, not what they're used for, the
Yeah.
vapes, they're definitely marketing,
This one was marketed for work.
yeah, a work safe vape.
oh, yeah.
And I-
Work safe,
Or
babe.
work,
Yeah.
work, yeah.
And
I
you
mean,
can buy that in a
yeah, I-
vape shop in
so-
Iowa.
Where'd
The
you buy
cup
that?
one I bought from Carol, the one next to Walmart.
Okay.
This one I went online, I just typed in vape pen, and this was one of the first things that popped up, so I put it in my cart, like Amazon, put in my home address, my credit card, and they shipped it to me.
They didn't ask
Who you
anything
were,
about
how
how
old
old
you
you
were.
Oh,
were.
they did. You
I
had to
had
click a
to,
button.
I had to click a button that said I was 21.
Oh, that was hard,
Yes,
wasn't it?
so,
Oh,
Yeah,
yeah.
but I
As
didn't
long as you
have
can
to,
read.
yeah,
Yeah.
didn't have to put in my ID, my birthday, nothing like that. But yes, this one came online, it shipped to my house.
So is that actually legal, you know, as an adult in Iowa?
Mhm, yep.
So what
What's
makes,
the age? What?
Just
21
21.
in Iowa.
Okay.
so what's in it that is
So-
appealing to somebody?
Nicotine.
Yeah.
It's nicotine,
It's just
not,
nicotine. Most places like the hospitals are tobacco free, so you
Okay.
can't vape on hospital property.
Okay,
Well, if you don't know it's a vape and you're in your office and nobody can see it,
okay.
Cause I mean, I always keep a pen on me.
Yeah, I
How
was gonna
easy
ask
would
you
it
about
be
that.
to-
I was gonna ask you about that.
This one is just normal.
I was gonna ask you about that.
My other boss, his biggest pet peeve is not bringing a pen to a meeting.
Yeah,
So I just keep it clipped on my badge, so when I go
Yeah,
to
yeah.
schools, I'll just slowly switch it out.
Yeah,
And
so that's mostly for people that are trying to get over the smoking, the nicotine.
potentially,
It's not,
some people nowadays, some people don't even start smoking, they just start vaping.
okay.
So it's kind of taken the place of some cigarettes, some not. You still have both things. It's still tobacco, it's still nicotine, depending on the vape you choose and something
Yeah.
like that. Some don't have much in it.
But at
Um,
18, they
have
can
two in
get
town.
tobacco. Or
No,
that means
21
is-
it's
too?
21 in the
Don't
state of
we have
Iowa.
two
Okay,
vape
for
shops now?
everything.
Yeah,
I thought I seen something about Cal Tech posted that on Facebook.
There's one by
the other day.
McDonald's and there's one
Yes.
across
Yep.
the highway from
And-
there, I think.
Beer 30.
Oh,
Has a bunch
yeah.
of vapes in it.
Vapes,
Yeah.
yeah.
Oh.
You just have to, I mean,
Didn't
drive.
know
which
where
around.
over the 21 is absolutely legal, just
Right.
like alcohol. It's all legal over the age of
But
21.
it's, wouldn't be legal.
So the teacher has the right to confiscate or no?
So
What are
every
the
school has different
guidelines on that?
policies. It's based on the
Oh.
school. They all have their
Oh.
different policies and procedures in place. We just help the teachers know what to look for.
Oh, okay.
And every time
And then
we
you send like a Nancy McCarville kind of staff person, or that kind of, I can't think of
take
what
care
her
of it.
title is, but she's kind of.
I know administration usually typically
Yeah,
has, but each
has a
school has their
person.
own policy and procedure into
Do you
things.
get asked a lot about that policy and what your thoughts are on it?
We do, but
Don't give.
we don't
Yeah,
know.
I
That's not my
don't
place to
blame you.
advise. So I do not give any, they sometimes ask me, well, what have you seen in other schools? Once again, it's not my place to advise, because if I misquote something and I lead you in the wrong direction,
Right.
I'm sure every school has lawyers on hand, just like we
Right.
do.
I mean,
So-
they should inquire to those schools and,
Yep.
and share
Yep.
policies and things like
Yeah,
that,
just
like
you
counties
talk to other
doing.
boards.
Does that have a smell to it that a person should be able to?
Some do.
It can, in the recovery center, they can't vape, and I caught a gentleman vaping because he had a very, very fruity smell in his room.
Oh, okay,
Mhm.
okay.
So you can buy flavored ones, or you can buy straight nicotine, and the straight nicotine one doesn't have a smell.
Okay.
But if you buy any
Educated here,
flavored,
then.
One of the other things that we've started educating on is, so nicotine, like, if you have a young child using nicotine and they're not used to it, it can make them have like ADHD symptoms. So if you're not used to nicotine, it can make you feel very jittery and hyper and those types of things.
Even
So
like from the secondhand vape.
yeah, from the vape, yep, especially if they're the stronger, I mean, the nicotine varies in different vapes and how much there are. But, so some kids, if they're not used to it, they've just started using it, they can seem like maybe they're having a little bit more of ADHD symptoms popping up, and it might be nicotine.
And are they doing that on purpose for
Mm.
that type of a feeling? Do you know?
Not
just-
always, not always, sometimes it's
Just
just
'cause it's
a,
cool?
it's a
Just
cool thing to
secondary.
do, or somebody had one and I decided to use it,
Okay.
different types of things.
So
and like
far
with
away.
these, they're different milligrams.
Mhm.
This one is
Oh.
3 and this one is 6.
Oh,
And
wow,
even with our
yeah.
clients who are routine
Excuse me.
nicotine users, I had one try an 8 milligram once, and he ended up profusely vomiting for like an hour. Wasn't
Wow.
used to it. He had to drop down to the lower milligrams.
So that's that little pad thing?
Yeah, these are the little
white
pouches.
So you just kind of put that and keep.
They tuck it, typically they tuck it, not everybody does, most of them they'll just tuck it in their cheek,
Yeah.
and it
But-
slowly releases nicotine.
Do people do that at work sometimes?
I'd assume so, I don't really know that answer.
Just
Do you see
Trying to
any
figure it
abuse
out.
for like
trying to figure it out.
drugs being used in those vapes versus tobacco?
Oh, yeah, that's.
There was kind of a question I was
Yep,
gonna ask.
so we have had patients that will put, you can buy vapes with marijuana in them. You can buy THC vapes, online. I have had some patients that tell me they put their meth in there, they get their meth in them. If they're creative enough to get them open, depending on, there are some refillable ones.
Mhm, like this
Um,
one is.
You
so
can't
that one's
buy those
refillable.
with the THC in Iowa though, can you?
Not legally.
Not like, okay, oh,
But I mean,
You
but I mean Omaha,
can find anything you want in Iowa.
okay.
Right.
Omaha, you can buy it legally.
Right.
Oh, okay.
I've noticed they've got a lot more of their little stores
They
open.
have a kratom over there. I don't think THC's legal. Is THC legal? in Iowa?
Yeah, cause I was
Okay.
arguing with somebody.
I
the
can't
other
keep
day.
track of it. I have to,
I do my own research.
I have to keep up on the
Delta,
Iowa ones.
H, THC.
That don't sound, that sounds like you're looking to buy.
I know, you going on a road trip after the meeting? No.
We're letting her drive.
There are definitely things that you
For
can
one
get
more
in the
reason,
vapes that
right?
should be in there that are of concern with drugs as
My
well.
driving.
I'm so naive to this stuff anymore. I don't even know if I was very unnaive when I was a kid, but I am really clueless.
This is newer, it's not. Probably within.
Starting to
I think
feel
it's
old all of a sudden.
always been there, like.
Thanks, I was actually beating that off.
I know. I think a lot of it's always been there, it just wasn't as popular. Cause like I still remember, 15 years ago in college, how I got things into places and. So the stuff I think has always been there, it just wasn't as easily accessible as the web now. I mean, 15 years ago, it wasn't as
Yeah.
easy to order things offline. Whereas nowadays, you can get anything offline in 2 days.
'Cause I mean, the stash cans are still,
Yeah.
Well, yeah, those
Yeah.
have been around.
So that's.
I mean,
it's
this one's
nothing
pretty
new.
obvious, but.
Yeah.
So some of it's not necessarily new, I think it's just
That's
more
for money.
popular.
Put that in your refrigerator with money in it.
I mean, that's the intent of it.
Yeah.
People pull off things.
They'd
and-
probably be stashing other stuff.
Yeah, probably,
Yeah.
probably. So, we try and stay up on these obviously because the recovery center, people that don't want to join us that are court-ordered, sometimes will attempt to bring things in various forms. So we
Get
gotta
kicked
get really
out.
creative. Drugs are brought in, automatically kicked out. If vapes are in, it's first stern talking to the first time. And then we go from there. My heart cannot kick somebody out of a treatment center over a dang vape. I just can't do it. Our rules do say no vapes, but usually it's okay, this is your warning.
Take it in.
Take it and let's not do it again. We had got a tip, gosh, a month or two ago that we had a bunch of people with vapes and we had a gallon size baggie. After we did room searches and we had
27,
we had-
turned in.
done room searches, a month ago, but we have such turnover because people are constantly coming in. And somebody brings 5 in with them, it doesn't take long to pass around.
So do they, most time willingly, if you go in the room and say, hey, we're gonna search it, you think you have something, that they turn it over?
Most of the time. Yeah,
So they're good about that, they don't wanna lose.
at that point, they know that somebody's
Right.
Somebody's
for
running
a
them out,
reason.
they know, yeah, and then there's always a warning. Now, obviously, if it's meth, marijuana, those sorts of things, there is no grace period. You bring that into a treatment center, you're gone, and I'm pretty sure we're all across the state of Iowa, because that puts not only them at risk, but our staff, other patients, that puts a lot of people at risk, so I'm sure we're all the same about that, but we've had a little bit of a changeover at staff and Manning, so we're kind of getting, Nika and I put prevention on hold here for the last couple months to get things straightened back out. Which is kind of a good time of year, reach back out to the schools, see what we're thinking for next year. We've done a lot of Narcan training with this, we've spent, the last year, we've done a lot of Narcan training, over 16 schools around us. And anytime we go in, we also then bring up the vapes and the hidden stuff, even if it's for Narcan. We keep Narcan on hand at the recovery center. I think I have 72 boxes at all times. So when we do the training, we hand it out to anybody who wants a box of it. If I have somebody showing up the door that would like some, we hand it out. You can definitely get it at pharmacies, but it's like $50 a box. I know our clientele can't afford that most of the time.
There was
So-
another product besides Narcan that the vendor was at our
Fla-
supervisors.
Cloxidone.
Is that,
It's just a higher dose, and I do carry that as well.
you do?
So that's the 8 milligram and Narcan's 4 milligrams, which when we teach Narcan, I do tell patients, whoever I'm teaching, whoever we can, that Narcan's only 4 milligrams and it does not last as long as the opiate. So if your person took a bunch of hydrocodones and overdosed and you give them Narcan, that's gonna bring them back. But the Narcan is gonna wear off before those opiates do, so they're gonna go back downhill. So you gotta follow up and get them somewhere. Same with like heroin, and
Gives you time to get them to. a
it gives you
hospital.
time to get them somewhere, but the opiates are gonna take back over. The Cloxidone is higher dose, Cloxidone, I never say it right.
Thank you.
Cloxidone is higher dose, so it does hopefully last a little bit longer, but either way, ideally, those people should go to the hospital. Or if they aren't looking for help, the people around them know to give them another dose when they start dosing off. That's why the boxes always come with 2 doses in them.
Interesting.
So the goal is, always to prevent overdose. We're not necessarily preventing use, it's harm reduction.
Do you see heroin in this area?
Absolutely.
Just had to ask that out loud, because I wanna live in this naive world that heroin is just in the big cities and.
It is not, it is absolutely around here.
I didn't know if you're asking for the green room.
Every,
I'm just joking with you.
the only thing I haven't seen locally yet is there, xylazine is a newer one over the last handful of years. I can't say I've seen, it's actually a horse tranquilizer type, it's used for animals, horses, to bring them down, so Dave might have some out there somewhere, I don't know.
I know.
Xylazine, it's a horse anesthesia, like to settle horses down.
We don't have that one, we have Ace.
That'll be at a racetrack.
Probably the vet's
Xylazine.
office, the vets I assume have it, but, it's getting mixed into some fentanyl.
Farriers might have
meth.
it too. But I've never heard of it.
All
How,
of
is that a
those.
newer thing?
No,
Last 2 or
I
3
think
years.
it's for abuse, we've only seen it last maybe 5 years. I think it's just started being, but it's being put into meth and fentanyl, everything else, just,
Cheaper, maybe.
I assume so.
Do we have a lot of fentanyl here?
We have a good amount, yeah,
Can you do us a favor?
absolutely.
Bring us a report if there's any reduction next year.
So one of the things I would love to track
Oh,
is
yeah,
something
it's hard
like
to track.
that, but it's very hard to track because. So one of the measures that my clinical coordinator, I would love to be able to report to people is success rates versus relapse and overdose or those types of things. But a lot of people aren't necessarily honest. Either one, they are truly honest because they're sober. If they have legal involvement, they don't want to tell us that they've relapsed. They don't want to tell anybody that they've relapsed or they're using again. If they are giving an impression that they're sober, but they have relapsed, they don't want to tell any of us that. So it's hard to actually know unless you are physically drug screening somebody if they're using or not, if they don't want help. If they want to hide it, they're gonna hide it.
Yeah.
So it's really hard to know. The state does track some numbers based on like, I'd have to probably read again. I think most of their numbers come from law enforcement
Like EMS.
and EMS and stuff like that. We report on EMS, in Carroll County, anytime we use Narcan, we report that. So those things are tracked, but does that really give us an accurate picture on how much drugs are in the area? Probably not.
I just was kind of, cause they claim so much of this is illegally coming across the southern border. And if they really do shut down the border,
Is
I
it
mean, if
gonna-
they shut it down, they're doing that. But I mean, if that's really gonna stop this, cause they're pretty resourceful, the people that are trying to make.
I'm sure there's plenty of people in the US making it themselves.
One of our speakers was a manufacturer for 15 years,
Mhm.
made it out of his barn.
Yeah.
Uh,
So there-
Iowa.
yeah,
Hey, fentanyl.
he made meth and
He
mixed
was mad.
fentanyl into it, yes.
There's,
Oh my gosh.
Yeah,
there's-
there's a lot of their farms.
Yeah.
yeah.
He
Just
got-
like Templeton Rye back in the day, there, if you want it in the area, somebody's gonna find a way to make it. And fentanyl fentanyl is pretty cheap, which is why people use it. I have a lot of heroin users that will come in and tell me they went to fentanyl because that's what they could afford. They can't afford the heroin anymore. Heroin and cocaine are more expensive. And so they've gone to fentanyl. Well, fentanyl has always and will probably be always harder to, it's not as safe because it's cut with so many different things. There's no recipe out there that I have seen, doesn't mean there isn't, not that I have seen yet from my patients that have told me, there's just not that great recipe, whereas the other drugs have a better recipe for them.
Recipe.
Yeah,
So if
that's
you
the word,
see-
I don't know, it's probably better,
I
it's
know
probably more
exactly
drug
what you're saying.
related, but that's how I interpret it when they
You've
talk to
seen a
me.
reduction in like cocaine use because it's so expensive versus, no.
I just see my patients getting more creative how to get it. So really, I mean, I feel like when I first started in this business, the goal was to prevent people from using, which yes, is still part of a goal is prevention, but in addition to that, harm reduction. If somebody doesn't want to stop using, we're not gonna stop them. The
They won't.
law system might stop them,
That still won't.
but even then, if they really wanna keep using, they're gonna keep using. We're not gonna stop them. So how do we just keep people from overdosing
We
and
gotta,
flooding our ERs and
and
flooding?
Natalie.
They all are.
Cousins works in the
They
federal
always
pen
say,
down there in Arizona.
Statistically,
There's more
nicotine is the
drugs
hardest
than
drug to
Arizona.
quit.
That, my patients will straight up tell me cigarettes are the hardest thing they've ever had to quit.
Can't give it out
I
about
have
prison.
friends that, if they knew they were dying anyway, they'd start smoking again,
Yep,
you know?
yep,
because
nicotine
that's
is what
how
I'm told
much
is
they-
the hardest thing to quit over everything.
Statistically from SAMHSA, it's
Yeah.
also,
Do you,
So,
not, I don't know if you could share this or not, but
nicotine is
do you
the
know
hardest
how many
substance to quit.
ER visits you see in
Right,
Manning
with the-
that are
Yeah.
overdose
The fact that the
related?
American.
Oh, I don't know that answer. I'm sure we could-
What percentage of
Yes.
a year's time?
Probably a testament to
That'd be
education.
interesting.
I think
does,
ours would be
but-
skewed because of our
Still.
recovery center. People intentionally will drive to
Still a
Manning
lot of
because of our
people got
treatment
a
center.
ring in their back
And we do see
pocket.
that pretty routinely.
Back
I'll
pocket.
get calls saying, hey, this person drove to the ER because they want treatment. And they drive from all over the
Crazy.
state. So I think our numbers might be a little skewed. would be higher.
I know
But
something
it's,
that's probably
alcohol is
more
probably the highest trend there.
addicting.
Cause people want detox and a lot of
Yeah.
hospitals just won't do that where we will. I just won't turn somebody away.
Caffeine, yeah, as I said here.
And then I take that time to try and talk to them about sobriety and treatment and take kind of advantage of them being in the hospital doing that.
So do you have room for everybody that comes, or you?
No,
guys
absolutely
take-
not.
No.
Okay.
What's our waiting
I ask
list?
the questions I know.
I have 92 people on my current waiting list, and that is, their referral's only good for 30 days, cause I'm also the intake person.
So one of the battles that my board's probably loving are here lately. So we've really been struggling lately with, when I looked last month, we average 125 referrals a month. The first 75 are thrown out because of insurance. Either they don't have insurance, but our biggest thing is Medicaid. So we do take Medicaid, or only a handful of facilities do, but Medicaid has 2 different levels for each thing. So when you apply for Medicaid and you think you have Iowa Total Care, there are 2 levels. There's Iowa Health and Wellness and there's medically exempt. They automatically, from what I understand, and I could completely be understanding this wrong, is that they go to Iowa Health and Wellness. Well, that level does not pay for mental health and substance abuse. So when I get a patient saying, I have Medicaid, I can get treatment at your facility, great, we run it, we see Iowa Health and Wellness, I have to call them back and say, I'm sorry, but your level of Medicaid will not pay. And level is the best way I have to describe it, but I don't know if that's accurate.
Yeah.
And so we tell them how to get that fixed. All you have to do is either have your provider, and most of these patients don't have providers, they don't see doctors. You call the number on your back of your card, request medical exemption so you can get treatment. Takes 5 minutes, but it takes 45 days for that to work.
Usually the first of the month.
The
it
first of the
switches.
following month, if you call before the 15th of the month.
Oh, my lord.
So I tell them 30 to 45 days. And if they want treatment that day, 30 to 45 days, I bet 3/4 of those people when I call say, well, I'm gonna be dead by then.
Yep.
And then I sit there and I try and talk to them, and I'm trying to debate if I need to call a welfare check into whatever county they're in, because they finally reached out for help and I can't do anything.
I mean, that's terrible.
And that's half of our referrals a month. So Medicaid is, and when we do.
That's when you're actually gonna.
Yeah,
take
that's when
care
they
of
want
it.
help. And if your Medicaid is medically exempt and you're lucky enough to already have that on your thing, we'll try and bring you in as quickly as we can, obviously. But then we have the other challenge, okay, this population, they don't have a ride, they don't have a way to get to us. Medicaid will bring them if they have a 3-day notice, and that's if they show up to pick them up. We do have issues where the rides are get canceled, or they don't have enough drivers because the workforce problem it's always a problem. So then getting them to us is sometimes another tricky situation.
You ever, like, some of our, like, the juvenile detention center that I have, is my committee,
Mhm.
Central Iowa Juvenile Detention, they've got a huge car fleet.
Is that the Yes Center?
No,
No,
yes,
no, the
Center.
Yes
The
Center.
other one.
Oh, the other one.
Yes, Center's
Why is
over
that?
here in Cherokee,
Yes.
and this one's in Eldora, but they've got cars everywhere.
They do, but I don't take adolescents, the juvenile system.
Oh,
So
so
our-
they won't,
Oh,
they don't,
I don't
but
know
they
that
won't
answer.
haul adults?
I don't know
I
that
think they
answer.
do. because
We
they-
hauled
they
one
work a lot of
recycling the
different
other day
things.
with them.
Will
He's
they,
probably into more stuff than
Will they
Elon
bring-
Musk.
we'll have to look into that.
Check
That's,
it.
that's
He
one of
does
my
do a lot of
biggest,
different things.
Oh,
We have
yeah.
their number in the ER.
I know for the ER I've used that, I didn't think about for treatment though. Cause there is somebody local that is a retired alcoholic that will pick up people local. But we get a small population locally. But most of our patients come from Des Moines, Sioux City, Omaha.
I thought you had checked
Mahaska
that one,
County.
might be helpful.
Yeah, that was definitely
Central
something
Iowa
to check into.
Juvenile Detention.
Tony Reed.
Tony Reed is the guy that's the director.
But we do have some struggles with there,
I don't
but
remember the young man's name that's in charge of transportation, but Tony will get you the right.
so like
I'm sure it's
currently
on
we have
their
92
website.
on our wait list. Those are the 92 that have been passed insurance checks,
Check their website.
have at least some sort of way to pay. And then sometimes they're in jail, so we work a lot with the jails. If anybody's court ordered, the sheriff will bring them. So we do get a lot of, we see the sheriffs on a routine basis. So the sheriffs will bring, we do have a lot of court orders. Just within the last 6 months, all of a sudden now we are having an issue with court orders not getting paid by Medicaid. So we're trying to decide if we're gonna have to put those on hold, which then is gonna leave people in our jail system longer, which is terrible. Cause we probably have 6 or 7 sitting in Polk County waiting to come. But we've just, in the last year, all of a sudden incarcerated patients, which when they're incarcerated, they don't have benefits, the jails are expected to pay. Well, when they're released, yes, when they're released, Medicaid's supposed to kick in. Well, we've had a handful of jails and judges that have put like a temporary release, but they have to come back. Well, then Medicaid's saying, nope, they're still incarcerated, the county has to pay. Well, this is new, so I have like 6 pending ones that aren't paid. And I have billed every county. We'll see if the county pays us or not. or
Which
if we're
what
gonna-
really needs to change there is
That
when
needs
they're
to
incarcerated, they're
change.
still underneath Medicaid.
Yes.
Because right now,
That's
100%.
actually a national.
we're using property taxes to cover those
That's
Yes.
expenses.
Yep,
We
Question that I
actually
have
discussed that at our
that
national.
starts when
association.
you say they're coming from Polk County, shouldn't they have enough beds in Polk County and save beds for?
absolutely not.
No.
There's not enough in the state of Iowa. There are not enough beds in the state of Iowa to accommodate places. And then when you add to it, so Medicaid, there's maybe 6 facilities in Iowa, 6 or 7 that take
We're one of
Medicaid, we're one of
7.
them. And we are
just
one of
shut down
3 that
some.
take Medicare.
You know how many
It's-
overdose
it's not
deaths
on my way today.
happen in Iowa in a year?
I don't know off the top of my head, but SAMHSA does actually track that. You can easily find that online. The overdose deaths are tracked and reported to the state, and it's a nationwide tracking number.
Say they're handed.
In 2023, there was like 217,000, I think, in the United States.
And I don't remember that off the top of my head, but SAMHSA that's where I always go, is SAMHSA's website. They keep all those numbers updated. They do all the research. That's who we report to.
How
So
many people do you guys treat? You said in 92 on a waiting list, how many do you treat at one
we have
time?
16 beds at a time
16 beds.
inpatient. You know, and things, people leave all the time. So the downside that we have and that we're struggling with is I have 16 beds. Well, maybe I had 4 leave over the weekend AMA. By the time Monday rolls around and we work to get people back in here transported, it's Tuesday. So here all weekend, I've had 5 beds open. But we are looking at admitting on the weekend. It gets very tricky because most insurance companies like Blue Cross Blue Shield require us to prior auth. So we absolutely can't bring anybody in with Blue Cross Blue Shield on the weekend because there's nobody working on their end. Some of the Medicaids, like Iowa Total Care, we have a really good relationship and we could bring a patient in at any time of the day and Iowa Total Care would work with us. Because we have a good relationship with their representative. And same with Wellpoint and Mirror Group.
Mhm.
Molina, not so much, but they're newer, it takes some time, but the way they do things, we don't get one person.
So you can't build that relationship.
No, we can't build that relationship. United Healthcare is the same way, you have to prior auth. So when those patients are scheduled, we actually have to get them in the building, do their assessment, then authorize with the insurance company and hopefully approve them to stay. 99% of the time they do.
When they're there is when they need to get in. They're
Yes. Mm-hmm.
not gonna go home and quietly wait.
100%, which is why we do the things we do.
I know.
And we do it that way, and 99% of the time, we get an approval and we don't have to fight too much. We do know if you have Trader Joe insurance, if you work at Trader Joe's, your insurance company is not gonna pay for more than 21 days, and we will never win that battle. So we've learned what insurance companies, we can get a little bit more leniency. There are truly our patients that need 60 days of treatment. And if we can prove and validate, as we should, absolutely through ASAM, that patient needs that treatment, a lot of the insurance companies will work with us. Medicaid actually is probably one of the easiest to work with if they have medical exemption. But if they don't, which is half the patients, we walk you through how to do it. We will tell your referral how to do it. We will tell everybody we can how to do it, what you need to do, but then you have that waiting game.
Would you
And then you
sign
hope
up for that
you're still alive.
exemption knowing that you have a drug problem, or does that
Most
exemption?
people don't know. Until they look out for treatment, they have no idea that that's a thing. If I didn't work where I worked, I would
Yeah.
have no idea either.
How do you get that word out?
I tell everybody I can, but that doesn't mean anything.
Is there any chance that, you know, they awarded Iowa Primary Care with the Behavioral Health Administration or the ASO, that there's a way to get funding through them to help with substance use and mental
I
health?
don't know that yet. I'm hoping so. I
I
listen.
mean, I don't even know who a contact would be, but I know they got awarded the ASO for
They did,
the
I
whole
did see
state.
that. I listened to the meetings, but I haven't figured out the good contact yet. I've spent time, so this medical exemption thing isn't new. And I've talked at the state level about it, with DHS, with HHS, with multiple leaders of our state about these problems. So I know it's known. I'm sure it's just not that easy. I feel like in my mind it'd be easy to fix, but I guess I don't know.
Why wouldn't it just be automatic?
Uh-huh.
Why does
I
it
know.
anytime?
Why do we
you
have 2
sign-
levels of Medicaid? Why is it
Right.
just not Medicaid is Medicaid?
Why is
Right.
it so simple for us
I
in
agree.
a 2-second meeting to just say, well, why is it just normal that you have Medicaid, you have that?
I
That you haven't
agree.
had it when it's
Right.
so,
I agree.
seems so
Cause
simple.
it's the government.
I
They
know.
have to
you
make it
for
confusing.
your-
It's the federal government. Can't
Two
make it
departments,
simple.
both of them are fighting to keep their job.
Oh, Lordy.
And we run into other problems too. So like I said, we might have 92 on the waiting list. Well, if we have a bed open up tomorrow, first 60 will probably tell us, oh, maybe next week, oh, maybe
Yeah,
next week, maybe
yeah.
next week.
I've
So
decided I
sometimes
don't need it.
it's frustrating because we might have a bed open for 3 or 4 days before we can get it filled because of either 3-day notice for transportation for Medicaid. But yet, how do I tell that person, okay, I'm sorry, well, then you're gonna have to wait because I'm not gonna let this bed stay here for 3 days. I can't do that.
While they're
I
working
can't.
on it, and then they get it
Well,
all.
not if you got 92 people waiting for
I
that.
know, and I feel like my guilt gets me a little bit. It's like, how do I pass somebody over who needs that 3-day notification, but yet I have a bed sitting here for 3 days?
That's why we
And
don't
maybe
wanna
you
talk
pass
to
them
half the
up
time.
3 different times,
She is-
and they're still
you're different.
patiently.
Than the first time you were here.
I probably am. I
Well, no,
continue to
you are.
grow.
You- I mean,
We all grow.
obviously, you can spit more off the top of your head than you could that day, but I mean, you can tell your emotional investment's still there,
Mhm.
but you're also more businessy because of it, it's probably made you that. way.
It's,
It has, it has.
Yeah, I mean, you
Yeah.
can just
I have
see the
spent more
difference
time
in
in
you.
politics the last 3 years than I've ever wanted to.
Yeah.
But I also, some of my staff get frustrated with me because not only do I look at the fact we need to fill the beds, but I also know my board's gonna hunt me down when I have 72% occupancy for 6 months in a row, as Dave knows, because the last 6 months, we've had low occupancy rates.
Hey,
And
I
it's
got
not that we
95 that one.
we had 95 1 month. we kind of hit a snafu. We had ruined a lot of our relationships with our referral agencies because we were focused on filling the beds, that we were just taking whoever would walk in the door. Well, the people who did the processes right and were referring like they were supposed to, instead of telling their patients to walk in, were getting passed over. So we're trying to find that happy medium of how do we be respectful to our insurance agency or referral agencies, but yet not leave a bed open for a day because somebody needs that bed.
Yeah.
So Brad and I are working at a lot of things, and we're trying to refine our
You could have
process.
60
retune.
beds and you still wouldn't have enough.
We still would not have enough, and we still would never have 100% fill rate. So what I would love to see in Manning is an expansion. I would love to double
Well,
my
that's what I was gonna ask you,
occupancy.
because I know we've been talking about that.
I have been, for about 2 years, we've been looking at this. What I would like to see in my mind is a double what we have. I don't wanna see 50 beds, because then we lose the program that we are in Manning, that we're known for, that the state calls me for help for. Currently, when HHS needs something, they call us. And that's huge for, I think, our reputation and stuff like that. So I don't wanna lose our program by adding 50 beds that may or may not be filled. I think
You
we
don't wanna
double.
just be a babysitter center.
No, we still wanna be beneficial. We still wanna be useful of people's time, money, and resources. We don't wanna abuse those. So if we double, I would ideally like to have 2 rooms that are used for not staffing or not routinely filling, but keeping open for our IV drug users, our pregnant people, that I can get them in quickly and then move them over. So kind of like an overflow area, like 2 beds. Currently, I utilize the hospital as that. If I have a pregnant woman call and I don't have a bed, they go to the hospital side. However, it has also worked in the wrong direction for us, because then they feel isolated. They are not in with the group.
Yeah.
They feel they have more emotional issues that aren't addressed. I thought that was still a solution, and it's kind of come back that these patients are like, no, you're making me feel worse by doing this. Yeah, you got me in here, but I feel terrible being on the hospital side and having to walk down to the recovery center. They feel they're isolated, that they're not in with the group, they're not getting the treatment they deserve, and then they leave. And now I just ruined this pregnant person's view on treatment. So that was initially our solution, thinking we were going the right route, but the patients have come back and said, hey, this really isn't. Some patients can tolerate it, some people can. Most new, have never experienced treatment before, extremely emotional, pregnant, those types of things, they don't handle the isolation well, and that's not the intent.
And there's never been a lady that's pregnant that's overly emotional.
Never,
Oh my God.
So we're definitely looking at a lot of things. Some of that, I'm hoping is gonna come with some education for my staff. I am looking at a couple different new educations on PTSD, postpartum depression, and some adolescent education, just with, we've done more evaluations at Crawford County in the last 2 years, and done some more stuff in this area that I feel my staff is gonna start to needing some more education than what we've had. So that's kind of our goal for this year, is to keep pushing our prevention, maybe do a little bit more of this hidden in plain sight stuff at events, and education of my staff are the 3 goals I have for this year. In addition, with myself working to see is an expansion something we should be doing, or is it gonna run us into the ground?
Okay, have you worked with Amy to run the numbers on expansion, and say if you run 90% full occupancy all the time and have that overflow, just.
Yep,
Does it-
she's got a couple different layouts. I have not seen them yet. She's working on them for our next meeting in a week, I think.
That's next week.
Mhm. A week, or every other Wednesday we meet, and we don't meet tomorrow, so it must be
No.
next week.
Are you, we're not, I think we had a board meeting this Thursday.
So it might be tomorrow that I have a meeting with them on that, but yes, she's running all the numbers, like, to look at what our, not only, cause also I'd have to add staff. So what is the cost of, would be to add staff? I also we do have an architect putting numbers together of what this would cost.
I'm building a completely
I have the
Facility.
blueprints done.
right there next to the.
It would be added on to our facility. Yeah, we have blueprints done, some things, numbers, looking to see, okay, you've gotta run all the numbers. Is this worth it? Will it ruin what we have? We don't want that either. We don't wanna lose any beds. But is it beneficial to do that? I don't know. I'm all on let's dive and see what happens, but that's not my job. That's Amy's job and the board's job. They're like, okay, Taylor, we need to bring you back in.
And we did explore taking over Jackson Recovery up here, but it just was not a good fit because we were.
The reimbursement rates.
Reimbursement rate, we were spread out, trying to staff
Maybe
it.
too
It was
thin.
not logistically.
We'd have to hire somebody, and with the reimbursement rates, it was like 20% of what we actually get paid, because it'd be an
We really
off-site
have nothing
location.
here, do we?
No,
No,
Jackson left.
Yeah,
they're
we
gonna-
have nothing here.
so we make sure that there is something coming to town.
Is there?
Really?
There is.
God, tell me that's true.
Oh my goodness, there's something, and I should know what this is. I had gotten wind of somebody opening an office for just,
Chris,
Yes, Family Access
Family
Center.
Access Center is coming down, but she's only doing adolescents.
okay.
She's
But
not doing
still,
adults.
Still,
Yes.
it was something. So we work with Family Access Center. One of my counselors works full-time somewhere else.
Yes.
And she did, I know she said they were doing something in Denison.
Yeah, she was taking over for adolescents because she was talking about it at work one day.
Yes.
Wonder
So
where that'll be.
I don't know that answer,
It,
but,
it was just her coming
Oh,
over. It's
okay.
not Family Access Center, it's just her.
Okay.
but I think, I don't know if they, cause I know like we had reached out to the juvenile. My boss reached out to him, so I can't think of his name for the life of me.
Nate,
Yes, and had reached out to him and stuff, and we are working with Crawford County. Out of their ER and type of stuff, but Family Access is also looking at helping that out too, so between the two of us. It's still not what Jackson provided, it's still not gonna be as much resources. But it's a person,
Yeah.
and I think she'll be in
That's good.
Denison one day a week
anything
to
that can
help.
help Nate is, Nate's really passionate about the kids, he really is.
And we are always available, it just takes a phone call to myself, and we can figure almost anything out.
His office is right straight across the hall.
We've talked.
Have you?
Yep, we've talked, just like with the veterans thing, at one point, 2 years ago, we looked at doing a veterans program. Well, what I have learned is there's no reason for two of us in a 20-mile radius to do the same program. So if I have a veteran reach out to me, we do have a program down the road about 20 miles that has a full veterans program up and running
Where?
in Baird.
In Baird?
Yep, at St. Gregory's, so they have a veterans program. So are we wasting resources having two of the same programs 20 miles apart? Probably, because we don't get a whole lot of veteran referrals. So the handful I kind of talked to, do they want a veteran driven program? Then I will help them get to St. Gregory's. If they don't, we will gladly still treat them and involve PTSD and some specialized treatments to that person. But if they want a full-fledged veteran driven program, there's no reason for two of us in 25 miles. So just kind of making sure we're also not double using all the resources we have to create the same wheel in a short area. We have 4 treatment centers in our area. We all do things a little bit differently, which is good, because if a patient comes to Manning and doesn't like it, they still have other options, or vice versa. It works both ways.
4 treatment centers, community.
Yep, so we have us in Manning, Ivory Plains is in Adair, St. Gregory's in Baird, and Midwest Behavioral Health in Jefferson, Scranton area. It's kind of what we have in our little,
Yeah.
they're still distance, but it's
Yeah,
kind of what we have outside. If you're going the other direction, you got Jackson and Sioux City.
Yeah, yeah.
Jenny Ed and multiple in Omaha, Council
What's
Bluffs area.
that new one that just opened up? It's like 6 beds. It's in Scranton.
That's Midwest Behavioral Health, Jefferson Scranton.
I didn't know that.
Yeah, that's Midwest Behavioral Health.
That's only 6 beds.
It's only 6 beds in the residential, they have outpatient too.
It's better than no beds, so take
It
it.
is, but like I said, Medicare is another big thing. There are 3 facilities in Iowa, including us, that take Medicare. Medicare has a lot more requirements. We only have the ability to accommodate that because we're attached to a hospital. You have to have 24/7 medical staff.
Okay.
And we do have that because we're attached to a hospital. So most places can't accommodate that.
Yeah.
And same with Medicaid, you know, the reimbursement rates. We have added some more Medicaid providers in the last couple of years since the Medicaid reimbursement rates were increased 2 years ago. But is it gonna stay that way? We don't know. That's always an unforeseen thing. We don't really know if they're gonna stay where they are, or if they drop back down, we're gonna lose Medicaid providers, because we were even to the point of trying to have to decide, do we need to limit Medicaid patients? Because we couldn't afford to keep the doors open anymore at the rate we were going. And the goal is to be here in 40 years, not to go out in 10 and serve a bunch of people in 10 years. The longevity is the goal. We still need to be here. So we're kind of hitting a lot of things.
Well, something tells me this isn't going away.
No, it's not going away. It's just the trend of the year.
It'll evolve.
So we've pushed with the county money, the opioid funds. We've always focused on prevention. And that still is a big focus of ours, but I think we're limiting ourselves. Like I said, the 3 kind of goals that we have this year is to look at education. We're pretty good at keeping our staff educated, but not as well as I think we could with some of the new trends. PTSD is becoming a bigger and bigger area that we're not covering. The adolescent population, like I told you, is kind of new for us. The staff I currently hadn't really been trained in adolescents. We took that on last year with Jackson recovery closing, because they did adolescents, we didn't both need to do it. So I could, I have some staff that are gonna do some more focus on it. Adolescent training, PTSD, prevention, and kind of focusing in their areas, as well as DSM manual changed, and we have, not DSM, I apologize, ACM. The ACM manual changed, so I have all my staff learning the new ACM guidelines. That at some point the state will tell us to start using. Thankfully, they're not terribly different, but they're looking at that as, you know, medicine always changes. There's always something new to be up on and how it affects people and how it does. So education is a big part of my staff as well that we need to stay up on. So kind of looking at finances for that.
Well,
As well as
PTSD,
prevention.
you know, everybody, they always tie that to veterans because of war, but you
Yep.
know what, most of our drug users stem from an early childhood trauma because it stems with mental health and it's just,
Absolutely.
and that's a PTSD moment there. I mean,
Yep.
PTSD has happened, pretty much all of us have had something.
Yep.
It's just a different
And
level.
it is,
That's how you process.
Yeah,
and where it sticks.
right.
So, and a lot of patients, it's from healthcare. You know, you have a heart attack and now you got a little bit of trauma for the next 2 years because you're worried that every little inch or
Yeah,
twinge is a heart attack.
yeah. That's
So
something.
how do we, you know, and I'm constantly telling my patients, you know, maybe let's do 6 weeks of therapy. Just give it a try. See what you think. Sometimes just to vent in a room to somebody is what you need.
Somebody talk you off the cliff.
Yes, yes. We in Manning we've been trying to hire another therapist. They're hard to come by. My one's full. And we do everything we can to fill it up, but those aspects, we're trying to make sure that we still have our holistic approach to the hospital and the recovery center. Making sure we're educated, we're still hitting the prevention, still hitting the schools, but not losing focus on the fact that we're still a recovery center. So I know last 2 years, I spent a lot of time focusing on prevention, but I don't want that to take away from the whole aspect that we're doing with outpatient and treatment. And not only preventing, but also harm reduction and treating those who maybe aren't ready to stop, but they have to because DHS said they had to.
It's a lot.
Yeah.
A lot.
So kind of looking on all those, so that's why we constantly come back here is reaching out for the opioid,
it.
which is good. Dave gives me nice little reminders like, hey, it's been 6 months.
Yeah.
Which I got in December and I was like, oh, December was a little crazy.
I ask a lot of questions, but
I think it's money well spent, without a
Oh,
doubt.
absolutely.
without a doubt. And
Well,
I'm
we
just
haven't had
thank you.
anybody come to the table.
You
for
have a
those
passion.
dollars.
Yes, I did, which shocks me,
Yeah.
which really shocks me.
Right.
Yeah, but
But-
you see the need and so thank you for
Which
coming.
we keep trying to do. One of these years, I'm hoping to find a way to help those who don't have insurance. That's one of the goals on my list. Because currently we have no options. If you don't have a way to pay, there's nothing I can do.
And that's where you're sympathetic and that you just feel so bad.
Mhm.
You see the need and because of money and lack of services.
That could end up
turning
actually being a
somebody away.
PTSD thing for your staff, when
Yeah.
they see somebody that's desperate to
Yeah.
get help
They do.
and they have to turn them away.
Well, my staff learned a long time ago that if they really want something, they can pull at my heartstrings with a patient.
Yeah.
Cause I've had to find a balance of,
If I
I
can't tell
s-
somebody, no, I send them to Taya.
I still have to
She
say
can
no
help you.
for a lot of things, but like, sometimes we'll have a patient, you know, around the area that's been through our treatment program 4 times. And it's not uncommon that somebody's been through our program 4 times. I'm like, okay, it's time to try somewhere else. Well, then I'll get my staff, be like, okay, well, they have Medicare. They can't go anywhere else. Or, you know, they don't have the ability to tolerate this, or this. And it's like, well, so then I sit with my, you know, another medical provider and my clinical coordinator. It's like, okay, are we really ethically doing something wrong by taking a person back who we know has failed our program 4 times? Or are we being wrong by not taking them back because they don't have anywhere else to go or things? So we do have to look at a lot of situations very close. My staff does know if they're very passionate about a patient coming back in, they can probably work me over in the right direction that they want.
Yes, it does make you wonder though, why they just can't get the message, why it's so, what is?
Well, you
what
know
is it
something though,
for?
it's them weak moments,
Mhm.
and once you get them things are,
Yep.
you know, you were talking about earlier, how they're so addictive, some of those things.
They are. And usually that's what we try and focus on is, you know, okay, we've done our base program once. What didn't work? What did work? What kept you sober for the 6 weeks you were?
Yeah.
Let's focus on that. What was the trigger? Do we need to break that out? What's the next plan when that trigger happens? So my staff is really good at relapse prevention and especially if you've been to our program a couple times, we try and limit it to 3 or 4 times that maybe you need to try somewhere else. And most people understand that and they will. Because sometimes getting a different point of view is what you need.
Yeah.
One word just kind of might turn that thing around,
Yes,
but
yep.
addictive personalities, you know, some people are more addictive
Yep.
and, yeah.
One of the other things that in August we are hoping to start is a MAT clinic. So MAT is medication assisted treatment. One of the things that I focused on a lot last year is there are medications to help people decrease cravings, decrease addiction. Some of it's just harm reduction. I do get a lot of providers like, well, you're trading one drug for another. Yeah, you can see it that way, but if my patient's using what I prescribe instead of using the fentanyl off the street, are we not having a better harm reduction?
I believe so.
There's less chance that your treatment's gonna kill them.
Yes, yes.
Is that the one opioid session we went to, they were talking about
Much less.
using some other,
Suboxone and methadone, yes.
yes.
Yes, So I do use Suboxone, I use naltrexone, Suboxone, Camprol. I use a lot of medications to help with cravings and stuff like that. But I feel like there are a lot of people in the area that would benefit from it that don't come to my treatment center. There is an outpatient clinic in Carroll, that is open a couple hours a week and stuff like that, but I get a lot of referrals from, Harlan. Harlan sends lots of patients to Council Bluffs right now. And there isn't a local area based treatment, mat clinic. It's something I approached my boss about a few months ago, that once I am done with my classes in April or August, that I really think we should approach that in Manning. Cause there are patients that currently come to our clinic that will ask their providers about it. Well, they don't do those medications, but I do. I just currently don't do it for anybody outside the recovery center. So we do want to offer that out, that you don't have to be in the treatment center to get help for addiction. Outside of, you can come for therapy sessions, but also medication assisted treatment. So we will be hopefully branching that out August, September time. Once we jump through all the hoops, make sure billing is appropriate and all that
It's a lot.
stuff is done. It is, it
It's a
is.
lot.
But it's a service that can be easily accessible for anybody. So.
We
gotta get that
appreciate
going.
you.
How many years have we, is this our second year? Third year?
Second, no, it's second. It's the end
Second,
of the
I think
second.
we've done 2 payments.
Mhm.
2 payments, and they usually come in twice a year, or once a year, or do you use it when
I
you
don't
request it?
remember I don't know. I'll probably be looking at it real soon, and I don't remember. It's like in the fall when we make our payment.
It's been about 6
So
or
it's like carryover from
7
the
months.
year before
Yeah.
stuff. And we're starting to get a little bit, at that, whenever it was, I don't even know.
Does that come out of 51?
It comes out of the opioid fund.
The opioid itself, that's not in, that's not in the, okay.
Yeah, the money that goes in there comes from the Walmarts, the
Yeah, yeah.
CVS's, those people that had the
Mhm.
claims filed against them, and we're a part of that claim, and we receive those dollars, so.
And just for refreshment, our
That's
commitment was-
looking at, we're looking at 20-some years probably of monies coming in.
Mhm.
Different levels of money, it's not always
Yeah,
gonna
yeah,
be $50,000 or whatever, it's not always gonna be the same.
But as a refreshment, that's why we went with the 50%
Yep.
to you guys, cause we couldn't.
Yeah, so
It
that
goes
way
up and
we're
down.
still open to other requests.
Yep.
But if the requests don't come, then we have a valid point to, give those funds.
The one thing I would ask in the previous times, we
Yeah.
kind of focused 100% on prevention. Which has been fabulous. It's got our prevention program up and running. It's given us the abilities to get that all started. But those initial funds, those are permanent things we have. We don't need to replace them anytime soon. If we have the ability to use some of it for education, the Hidden in Plain Sight program, other areas of need that we can bring out into the community. Not to supplement programs.
Just to let you have the money and then you determine what you.
Right, and just report back to this
And-
board how you're using it.
Yep,
I'm with you.
Yeah,
I agree.
and
I
if they
just-
ever have
We have no
a
way.
question about how you're using it, then they
Yeah.
can ask at that time.
And the hospital tracks things
And they're
very
doing an
well.
awesome job.
I just, yeah, no,
Which
I'm.
we
Because I
always-
always need
I
to
know-
know
I
it
do
when I
like to
do
know
my
what you're using the
reporting.
money
Yep.
for.
Because they wanna know.
Cause I said that in
And-
December, didn't I?
I mean, like,
did it
this
too?
stuff here helping people
I don't
ID
think
things.
so.
and
Yeah.
what's the-
I filled it out. I'll go back and
Did ya?
look. I know I filled it out.
I might have
Cause
lost
you
it
told me to send it.
When I
Well,
didn't
should I
show
send
you,
it
I
back to you?
got this off
Okay.
Amazon.
But I know I
Sent it
filled
to
it
you.
out, so my CFO keeps track of exactly where all the money is at, so it was
That's
so easy to
And I
get.
knew you
So
guys
like
did,
this.
so I
She
wasn't
keeps-
worried about it.
Shows off
And I probably
I'll
went
go
off
back
the
and read
last
it.
report and was
So
more
that was an
the
actual-
So far,
prevention
it's all
and
been
a little, and
prevention.
education,
Yeah, prevention and education
Yeah.
has pretty been isolated
So,
there.
yeah,
Pull
no,
the top
that's
off.
You think
cool.
that's what it is?
And then they got something behind it.
Yeah,
Can I show to you
I
that?
got this off Amazon, so.
I was gonna- Is this,
Yeah.
to me,
But
that's
like
just
this
our
is an
opioid
actual
fund, but it says
line,
it's
but this is-
grants,
Perfect.
scroll up.
Right, your
There you go.
Grants and training.
Cocaine, pills,
Yeah.
Right there.
meth
You read that
rocks.
paragraph right there, this county substance.
I don't even know what all
We are
that stuff
so
looks like.
out
I
of
really
the,
wanna
you know, this
Um,
group here hasn't had a clue.
Cocaine is kind of like powdered sugar.
Yeah, no cocaine looks like,
Yeah.
but I mean, like the meth rocks.
We've watched enough TV.
Yeah.
I don't think this is your opioid money.
It can be
Something
about
different.
this.
I think
big.
it's another,
And it
I
just
think
looks
it's the
like-
state, what they're using their
It kinda
opioid
looks
money
like
fund, not the
sea salt.
county stuff.
Oh.
Yeah.
Mm-mm.
Just a
No,
little
but the state,
bigger
I mean,
than
the state has so
sea
much
salt.
more
And what
money.
do they do with
What
that?
I see is this is another grant
Before they
opportunity that
can
we
melt
can
it
apply
and shoot
for.
it, like,
Oh,
With more
is
money.
that- Is that the spoon stuff?
Does
that
Iowa
you
have
use
what's
in
just
the-
You
called
can-
the substance
that's how you
abuse
shoot it up.
agency, or what are,
Yep,
what are
they
they?
can put it
you
in a
know?
pipe and.
It's under
smoke it.
HHS, it's
Under
under,
HHS.
yep, it's, HHS oversees us.
Candy.
That's why they do the right.
The
Yeah,
the Department of
Yes, no,
Substance
and then
Abuse, so it's Lori
you were
and
going
Amanda
as
are the
close
two that
to
oversee
communicating,
that.
which I would
Do you know
not
that
get
name of that
behind.
lady that
They
said
wrap it up
contact?
in toilet paper and.
I read it, I've never
I
recognized, I don't recognize it.
don't understand the point of
But
the
you know,
toilet paper,
it.
but
You see
it's.
it's all the website.
I'll shave it
Chandra
down so it
Jennings.
doesn't cut up
I
there.
cannot imagine toilet paper.
No,
making
so like
these-
Yeah,
our-
it doesn't completely.
the
cut up.
Lori and Amanda,
As it goes down, yeah.
I can't think of their last names from the life of me, are the ones that oversee substance abuse in
And the
Iowa.
plants are they're very open about it all.
And I email them all the time, but I can't think of their last names, cause I just type in their first,
Right.
and my email pops it up. Lori Hancock, Hancock Muck. However, I do know she announced that she is leaving. She took another position. I don't know if Amanda McCurry will be moving into that or how that will work, if they'll hire somebody else, but Lori's been there for as long as I know. And same with Amanda, they're the only two I've ever dealt with, and my predecessor had also always dealt with those two. So they've run the Department of Substance Abuse at HHS for a
So
long
you
time.
have the high
Does,
symptoms, it's just another way to get it.
how
in
it's working
without
with the payment
being-
schedule of.
Oh, yeah.
So
When
that's
Terry
just
gets that to
like
you,
this?
is that
Yeah.
working or?
Absolutely.
Absolutely.
Yep.
I mean, if it ever doesn't, or you need something different, sooner, prefer it later, you just have to communicate that.
So far, no, we've had no issues, and like I said, Amy McLaughlin, she keeps track of, she has a separate spreadsheet, so that every money that comes in for you guys, we have it accounted for, so that when Chuck Cherry needs a report, I just copy it over.
Where
A lot
you're,
of the
you know,
times-
right, if we got it, you need it.
We haven't so far, we've made sure that like Nick and I have correlated so that we don't go spending money we don't have.
Right.
Cause I
I
also
feel
don't
like
wanna.
we've got it planned out, so
Mm-hmm,
we're not sitting on a bucket load of money either. You know what I mean? It's getting distributed. And if we have the opportunity to share with someone else that has a need for the same type
Yep.
of resources, you know, perfect.
Yeah.
But,
Right, and
Right.
we get looking at that budget here, probably today, we'll look at that fund. We can always discuss how much to leave in there for additional asks,
Right.
and then how much we feel like we need to keep.
yep,
cause I think the last payment was around 44,000.
I think so. The first one was higher
It
than
was
that.
50, it was closer to 55, 60,000 was the first
yes.
payment.
Yeah,
Last year, cause that was 44 was only half.
Covered every inch of that chair.
Remember, it was
I
just.
think so.
half
I
of
think
this.
so. And I might have done more just because there haven't been any requests.
Could be.
I don't remember.
this
I'll look.
year,
I'm
We'll
very,
hold
I'm
that fund
very
balance and we'll
spoiled with
take a
Amy
look at
McLaughlin,
that.
she keeps track of it all for me, I do not have to track
That's
it.
nice if you don't have to keep track of
I
that.
track my monthly budget, but this money we don't factor into the budget, it's
Oh,
it's
That's
where we
cool.
can pull things from that we don't have to worry about.
Should have a
but-
little bit of a
It's the
cushion
above and
there.
beyond stuff.
hopefully. Yep, I'll take a look at that. Yeah.
And we've slowly, you know, we know this money is gonna run out, so every year we look at what we spend it on, so that we know 10 years down the road, we need to be able to budget for the things, so we have sustainability as well. So we keep track of that every month, I report it in spreadsheets, if I buy something or we need something that wasn't budgeted, so that next year we know to plan. And it's right about that time, I'm sure my budget emails are gonna be coming out here any day now, saying, look at your stuff and how badly did you go over. I think I'm under budget so far this year, I haven't gotten any naughty notes, we're still doing pretty good, minus overtime, minus staff overtime, but.
But you want to get it in.
Well,
I
thank
don't
you
know,
guys.
her
It's
board's
It's so
kind
hard
of,
to get away.
They're
with.
pushover on that.
Yeah, I can't complain from what I hear from some of my
Thank you
colleagues.
for answering all our questions and
Always.
I really,
Is also.
yeah.
I
I need
we're,
this annual.
we're still learning and developing I feel like every time I go to a conference or a meeting, I'm learning something new. I'm working with the University of Iowa a lot right now and doing their lectures every week. They do just public lectures for anybody that wants to listen, so I always listen to those on Wednesdays. And they'll talk about the trends and they'll also talk about grants and upcoming opportunities, which has been great. We just don't qualify for a lot.
we got a little bit out of hand here, I got a text saying we got too many conversations going on and I can't follow
Oh.
on Zoom.
Sorry.
Sorry.
Sorry, Zoom. It's just very,
We've heard
very
good about
exciting
Zoom,
what you're
so
doing because we
so
know
sorry.
the passion and
It's,
the work you're doing is
Right.
doing
Tried-
tremendous good things.
We try to pick your brains as fast as much as
Absolutely.
we can and still keep things moving, so
and
always reach out.
we'll definitely be here again in 6 months with new updates and new trends and any questions and.
You've got my card if
Yep,
you're.
I do. Yep, I got lots of contacts. I just figured we'd bring a little show and tell this time.
Appreciate
to
that.
Yeah, that's
See,
interesting.
it's been very interesting and I'm hoping we can expand a little bit on it yet.
Keep up
Cause
the
I think
fight.
it's good for parent education.
Grammar education.
Yeah, it's
And
definitely
most
good for my
parents don't know. I
education.
mean, I'm clueless. I'm a grandparent now, mind you, but
The kids are, I mean, the first time I found a vape charger in my child's room, I didn't know it was a vape charger. I thought it was a cell phone charger. So it took me a minute. So now I know, but
and this is your world.
yes, and my child still can pull things over on me.
Samsung charger
Out the game.
can charge a lot of vapes.
Yes.
Or one of the popular vapes, it kind of looks like a bowl on the end of the
Yep.
charging cord. You just stick it on top.
Oh.
One of the, I was doing a oh God, an education for kids, I don't remember where. And they had a vape charger in their computer and the teacher didn't know, so I went and I pulled it out and they went white and I'm like, oh, I know what this is for.
They thought it was like just a USB drive that was
Yeah.
plugged in the child's computer.
But
Yeah,
you can stick your vape on it to charge it.
So,
Stay in front of it.
yep, so we'll be
Well, thanks for.
getting ready for school next year. Well, thank you
Appreciate
guys.
coming in
Yes.
and thanks for all the info and
Back
keep
here.
up the good work.
Good work on your side.
And if anybody, I always tell everybody, especially providers, if you can't get through to us and you have somebody that needs help, Nick and I are easy to contact and we'll figure things out and walk people through how to
Okay.
get the help they need. So,
No,
Thank you. Very
thank
much.
you guys.
you
Have a
guys.
great day. Carry on.
Yeah, I appreciate it. Thank you so
No
much.
problem.
Interesting. She's a lot. A lot stuffed up in her head now compared to that first year she was there.
She has a lot of drive.
And she does.
Big hearts.
Good heart. You're
A lot.
right, Terry. That's what it is.
Well, we are kind of getting up to citizens input.
Yep.
Unless somebody else has anything they want to bring up quick. Anybody on Zoom for citizens input before we take a break and go into budget sessions after that?
Was she here for more money? Was that the objective or was she just here to give us?
Well,
Updates,
Updates, and just-
mostly. I mean, we're on the schedule to continue to support them financially, so
Yeah.
anything
we
that they
just
could
need to
get,
look at
And
those
on the same
numbers
portion
and-
of last year.
and make sure that
they would
we're-
use any amount we give them and
I
be
know
very
they-
grateful to expend it or to use it.
Yep,
Yeah, I mean, so if we're like getting a pool,
right. I don't think it's a lot.
okay,
What
but
we
if we're
have,
keeping
but-
it spent down,
I
then
know.
we kind of continue on.
It's kind of nice.
Anybody on Zoom
We don't have
for
anybody else.
citizen input?
I'm interested to know about
How long
the
is that opioid?
other people they were talking about
Funding
coming here
gonna
for the
continue?
kids.
20 years.
I
20
know,
years?
that's
That'd be
cool.
neat to see if they need.
Say again,
The funding,
Like 20 years.
20 years?
at
60.
least, I can't remember I have
At
some
the same,
charts.
at the same rate?
It's a
does it
little
start-
different
It
and
changes.
some of the providers drop off, they're all on a different schedule,
I see, okay.
so, yeah.
Isn't that kind of?
Colin brought us a chart or a list of.
What we-
for
Well,
like
no, it
10
depended
years
on
time.
what the
'Cause he
the
kinda
lawsuit brought,
Runs that.
cause they were all under a
Hard.
different kind of lawsuit, so yeah.
Crazy.
Well, I'm
I
gonna
know.
call our
We still
break,
have that list that Colin gave us on how much each
so we
year was.
can move on. I know Craig, you've got to get going, so you have your noon meeting back by 12:30. We'll take break till 12:30.
All right.
12:30.
Sounds good. So when we come back, we'll see Nate. Nate, and then Colin, and then Roger.
Since Sydney.
Potentially.
Plug this in.
Probably.
I didn't get one. Had to get a different phone. I didn't get all my uploads.
I didn't get Taya and this new one either here, and I don't
Still
have
don't know who
everybody in
uses
mine
it.
either.
I don't know either.
B block Peggy.
Hey, I know that. Talked to Peggy last night.
Who said they couldn't understand us.
I think it was